census relative to January of 2022. Next slide. So this slide here is a visual representation of the trend that I just discussed. The red line is the non-asylum census. You can see it's about 7% below the pre-pandemic level and well below the pre-pandemic peak of 61,400 reached in January of 2019. The blue line represents the asylum seeker, the total census, with the space between the red line and the blue line being the asylum seekers. You can see that the very rapid growth over the last 2 years has been very much driven by the asylum seekers. We noted at the beginning of this presentation that the DHS budget is $3.9 billion next year, a significant increase over the DHS budget before the asylum seekers began entering shelter in large numbers. The significant increases in the DHS budget this year and next year over prior years are primarily due to asylum seeker costs. 36% of the DHS budget this year is allocated for asylum seeker costs, increasing to 45% in FY25. This funding in DHS is allocated primarily for sanctuary sites, for the cost of migrants in regular DHS shelters, for supplies, and for staff and overtime costs related exclusively to asylum seekers. The current agreement with the state for reimbursement of asylum costs is 71% city tax levy and 29% state. As of March 2024, DHS has submitted claims to New York State on behalf of DHS, HRA, H&H, and other city agencies totaling over $1.5 billion. Last state fiscal year, the state allocated $1 billion towards New York City costs, and we are waiting for enactment of the state's fiscal year 24-25 budget to see if the state will allocate additional funds. The governor's proposal included $2 billion. More generally, we continue to advocate with the state and federal governments to provide adequate funding and pathways to work and sustainability for these newest immigrants to our city and country. Despite the influx of asylum seekers and its impact on our agencies, we have not lost focus on shelter housing placements. We have seen increases in permanent housing placements from the DHS system as a result of the agency's efforts to move families and individuals out of shelter. In FY23, there were close to 15,000 placements from shelter, an increase of 17% over the prior year. In the first 4 months of this year, there were 5,400 placements, an increase of 11% over that same time window last year. Next slide. Our engagement with individuals experiencing unsheltered homelessness is another critical component of DHS's work. Since the start of this administration, DHS has doubled outreach staffing. We have nearly 400 outreach staff on the ground as of today, and aggressively expanded low barrier bed capacity, bringing nearly 300 new beds online since August 2023 alone, with more than 3,900 such beds online as of today. As a result of critical investments in 24/7 outreach efforts and the intensification of end-of-line efforts as part of the subway safety plan, referrals to shelter and low barrier placements increased 70% in FY23. Since the launch of the subway safety plan in February 2022, more than 6,100 New Yorkers have been connected to shelter from the subways. And I'm incredibly pleased to report that thanks to critical investments in a comprehensive continuum of care, DHS more than doubled the number of permanent housing placements for people experiencing unsheltered homelessness year over year. DHS placed almost 1,000 New Yorkers residing in low-barrier programs to permanent housing in FY23. I want to pause on that figure. That is close to 1,000 people who used to sleep on the streets and subways who now have a lease and a place to call a permanent home. Next slide. I know we're all rightfully concerned about staffing. However, DHS has not had the same kind of headcount swings that other agencies have faced. DHS staffing has remained relatively steady over the past 18 months. As you see, this line here is relatively flat and has increased slightly since the end of last fiscal year. DHS headcount is just over 1,900, and the agency has a vacancy rate of 7.5%. Next slide. The DHS approach to PEGs is comparable to that at HRA. We look to avoid programmatic impacts wherever possible, but again, we're faced with some difficult choices. In some cases, we were able to achieve savings by improving service delivery. New York State created a rental supplement program, RSP, that can serve long-term stayers in shelter who are undocumented. By helping these families and individuals exit shelter, we will see savings in our shelter budget. Unfortunately, language in the state budget claws back most of the money for state budget savings, but we will be able to do a one-time cohort of about 650 households. DSS is required to use an outside vendor to administer the program, as we are not allowed to use the state system that we normally use. Once this vendor is in place later this spring, we will budget associated with asylum seekers. I want to be clear that the savings in the DHS budget reflect lower than previously projected asylum census for the agency. While there were savings in some of the other agencies responding to the asylum crisis that did change service delivery models, there were no service cuts for asylum seekers in DSS or DHS. Next slide. As I mentioned at the start of my testimony, our primary goal is to create a path to sustainability for low-income New Yorkers through 3 pillars of work: streamlining access to social services, addressing homelessness and housing instability, and creating economic stability. I'm going to talk about each of these in turn, starting with some of the work where we have successfully modernized and implemented process improvements to streamline access to social services and benefits. So the graph here is showing SNAP applications and caseload increases over time. The green line is SNAP applications, and the blue line above is the caseload. You've all heard a lot about DSS and SNAP and cash processing. First, I'd like to recognize that over the last couple of years, DSS saw the highest SNAP applications and caseload since the period immediately following Superstorm Sandy. As you can clearly see, that's the spike early in 2020. There was a surge of applications at the beginning of the pandemic. Due to our investment in Access HRA and the ability of clients to apply, recertify, and interview online and on the phone, we were able to manage the surge and ensure clients got these important benefits. The federal and state governments also provided a series of easements that suspended certain requirements and allowed us to postpone recertifications. This simplified the process for clients and staff during the health emergency, but led to spikes in caseload processing once normal requirements were back in place. These and other factors contributed to a backlog in applications and recertifications. But I'm very pleased to say that thanks to the hiring of additional staff, investments in technology, and process improvements, we have nearly eliminated the backlog. I will have more to say on that in a minute, but first I want to give some more detail on cash assistance. Next slide. This chart here, the blue line shows the total cash assistance caseload. The orange line shows applications, and you'll see both of those are rising. As the City Council is aware, in recent years, New York City has seen remarkably high increases in cash assistance applications and recipients due to a variety of factors. At the height of the COVID-19 pandemic in March of 2020, DSS HRA received nearly 13,000 more applications than the previous year, a 53% increase. That increased need for cash assistance has continued. In FY24, the average number of cash assistance applications exceeded 47,000 per month, demonstrating New Yorkers' continuing need for economic support. In addition, we have significantly reduced the barriers to access benefits. We believe that increasing access to benefits via our online platform and mobile app, Access HRA, results in more applications. That's the right thing to do, but also increases workload for the agency. Demand for one-time assistance is growing as well. One-time emergency rental assistance is growing as well. In FY23, HRA issued emergency rent payments to over 40,000 households. The graph here, both the blue and orange lines, show both one-time and recurring recipients. In January 2024, there were 505,000 ongoing and 5,000 one-time recipients. The increased caseload has budget implications for the city. The FY24 preliminary budget for cash assistance is $2.5 billion to support an average of 500,000 recipients through June of 2024. 816 million, of which 467 million was tax levy, was added in the preliminary budget for FY24 based on these projected costs. Next slide. As I mentioned earlier, I am immensely pleased to report that DSS has nearly cleared the backlog of 46,000 cash assistance and 4,000 SNAP applications, ensuring low-income New Yorkers can quickly and easily access the federal benefits that they qualify for. This chart tracks the backlog back to the beginning of February 2023. You can see it spiked in the summer and is down to almost extremely substantially down to very close to zero. Investments in staffing, technology, and process improvements have reduced the backlog of cases by 97% for cash assistance and 90% for SNAP. In total, the city processed more than 600,000 cash assistance and SNAP applications since the July backlog peak. Faced with a record number of applications as federal pandemic-related support expired, the city deployed a robust plan to process applications quickly and make it easier for low-income New Yorkers to access critical benefits. DSS hired nearly 1,000 new staff people since January 2023 to process cash assistance and SNAP applications, doubled down on training for staff, and strengthened remote application processes to make it easier to apply for benefits. The agency also worked closely with Chief Efficiency Officer Denise Clay and the Mayor's Office of Efficiency to identify application process enhancements to eliminate bottlenecks that contributed to the backlog. We also developed and implemented plans to expedite the processes going forward. As of January 2024, more than 1.73 million New Yorkers are receiving SNAP benefits, and more than 510,000 New Yorkers are receiving cash benefits. I'd like to thank our dedicated staff for their hard work throughout the pandemic and over these challenging couple of years, for their ongoing commitment to serving New Yorkers every day. It has been a difficult time, and they have done an extraordinary job under extraordinary circumstances. The lessons learned from this experience have made us better prepared to handle this high volume of applications in the future. Next slide. Cash and SNAP are our highest profile benefits, but there is so much more that the agency does. Even these additional highlights are just scratching the surface, but since I was last here to speak about the budget, we have also been able to expand child care assistance for those leaving the cash assistance roles, grow the Fair Fares program that provides discounted transit benefits, and get heating and cooling assistant grants out to those who need them. Next slide. Next, I would like to talk about some of the ways in which we've been able to further our goals of keeping New Yorkers in their homes, moving families and individuals out of shelter, and helping people remain stably housed. Wherever possible, we want to keep people in their homes. I want to highlight two of our most important tools for doing so. The bar graph on the left is our emergency rental assistance, also known as one-shot deals. This is a cash assistance benefit. What this graph shows here is that the number of households receiving emergency rental assistance in FY23 increased after a drop in FY21 and 22 during the pandemic. This year, we are on track to dramatically exceed last year's spending. The chart on the right shows our legal assistance programs, which are also critical to keeping people housed. In fiscal year 2023, the Office of Civil Justice, or OCJ, funded legal organizations provided legal assistance to an estimated 98,000 New Yorkers in approximately 43,700 households across New York City. These households were facing housing challenges, including eviction, disrepair, landlord harassment, and other threats to their tenancies. The number of households served in fiscal year 2023 is the highest on record since the start of the Universal Access to Counsel program. These services proved to be essential. The number of eviction filings increased by more than 57,000, or approximately 83% in the last year. However, it should be noted that eviction filings in FY23 were still significantly lower than pre-pandemic levels. Since 2014, OCJ has provided legal services ranging from brief advice to full representation in 291,000 eviction and other housing-related matters. Based on estimated household size, that equates to more than 700,000 New Yorkers served. OCJ will continue to work hand-in-hand with all civil justice stakeholders to make civil legal assistance available and effective for New York City tenants in need. Next slide. And for those who do enter shelter, we want to connect them back to permanent housing as quickly as possible. In FY23, DSS saw a 17% increase in permanent housing placements from shelter, and as the PMMR shows, we are on track to exceed those placement numbers this year. More New Yorkers are now living safely and stably in supportive housing units. In fact, 46% more New Yorkers were connected to permanent supportive housing in 2023 than in the preceding fiscal year, and as I mentioned earlier, 1,000 unsheltered individuals were placed in permanent housing. DSS has also taken steps to strengthen rental assistance programs. We've made city FEPs easier to use by reducing work requirements, eliminating the 90-day rule, allowing for the use of city FEPs statewide, and streamlining the program with technological improvements. To ensure that more New Yorkers gain access to affordable homes, DSS launched the Affordable Housing Services Initiative to use social service dollars to create affordable housing. Through AHS, DSS will be facilitating the creation of stable housing opportunities for nearly 1,500 households in shelter. Furthermore, the AHS initiative provides sustainable funding solutions to help not-for-profit providers secure long-term building-wide leases or even acquire permanent housing sites, while providing light-touch services for tenants who are formerly experiencing homelessness. DSS has also rolled out extensive training to improve and increase housing package submissions. Next slide. Now for the third pillar, creating economic stability. We recognize that more and more New Yorkers rely on our city's resources to make ends meet. In addition to the public benefits, rental assistance, and other essential resources we provide to help people get back on their feet, I will provide an overview of our career services and other supports that enable New Yorkers to secure steady income and live sustainable lives. DSS offers education, training, and employment services to help clients develop job skills and build a career that will lead to success and financial stability. These programs are funded in FY24 at a total budget of $300 million. As part of our revitalization efforts, we launched the Pathway to Industrial and Construction Careers, or PINC, program to connect clients to jobs in these two industries. We're also restructuring our career services programs and contracts to ensure that we are focusing on connecting clients to growth industries with jobs with long-term potential. Thanks to changes in state law, we are able to implement new income disregards to support clients' economic growth. This means that clients who are participating in training programs or who get a job do not immediately face a benefits cliff. As a result, they are more likely to achieve economic stability and growth. And one that I'm particularly excited about, we are strengthening the pathway for our clients to access human service jobs. In FY23, human service providers hired nearly 6,000 public assistance clients. This is a gain both for clients and for providers who are frequently struggling in the labor market. It's a priority to create and expand opportunities that will help low-income New Yorkers achieve sustainability, and our work reflects that. I will close by underlining our ongoing commitment to break down government silos and improve access to services. DSS, HRA, DHS work to confront challenges that bridge across agencies and jurisdictional boundaries. Overcoming these challenges goes to the heart of creating the kind of caring, compassionate communities we seek to live in. We appreciate the opportunity to testify today, and we welcome any questions you may have. Thank you.
Thank you for that presentation. I wanted to acknowledge that we've also been joined by council members Osei, Ung, Banks, and Stevens. I would like to turn it over now to Speaker Adams for questions.
Thank you very much, Deputy Speaker, Chair Ayala, and good morning, Commissioner. Good morning to your entire team, and thank you for being here this morning. I'd like to start out by asking some questions regarding asylum seeker response pegs in the preliminary plan. As part of the preliminary plan, the administration has decreased the citywide planned expenditure for the asylum seeker response effort by $504.2 million in fiscal 2024 and $1.23 billion in 2025, a nearly 16% reduction of the expenses over the 2 fiscal years. The administration has indicated that these savings were generated from a variety of actions, including the implementation of shelter time limit notices, efficiencies in HERC contracts, a shift of some HERC contracts to nonprofit providers, and the recognition of current census trends. Given that DHS doesn't operate any of the HERCs, Why are we seeing a PEG of $58.9 million in fiscal 2024 and $78.9 million in fiscal 2025 to DHS for asylum response costs?
Thank you, Speaker. That PEG is a reflection of really two things. One, that there are fewer asylum seekers in the DHS system than was originally forecasted when the budget was put together. That's overall that the census is a little bit, still very high, but it's a little bit lower than was originally forecast when the budget was put together, as well as the balance between the HERC system and the DHS system. The other piece of the savings that we contributed to was that we took over or are in the process of taking over some hotels from the HERC system and are going to be able to do it at lower cost.
How much of the cost reduction is the result of shelter time limit notices?
I cannot break out the specific dollar amount associated with that. Within the DHS system, we are doing the 30-day time limits for single adults and adult families. At this point in time, we are not currently applying time limits to families with children in the DHS system.
That's noted. In looking at asylum seeker response PEGs in the executive plan, on February 21st, 2024, the mayor announced there will be an additional 10% PEG on asylum seeker response costs included in the executive plan. This is in addition to the PEG included in the preliminary plan. Will there also be a reduction in the asylum response funding budgeted through DHS?
At this point, it's too early to answer that question. We're still working on the planning.
Do you foresee a time frame for that?
As part of the executive budget exercise, yes.
Is DHS planning any expansions or changes to shelter time limits to achieve whatever target you have in mind?
We are working in conjunction with the overall city strategy around time limits. We are not doing anything independently.
So you're not looking at pursuing time limits, additional time limits on asylum seeker families with children in the DHS system?
That's something that we're still assessing right now. I don't have any concrete time when that will be decided.
But you do see a potential possibility for that?
There's a potential possibility. It's subject to not only what is happening in the city, but also state oversight.
Does the administration have plans to transition any HERCs operated by H&H to DHS? I believe we heard part of that last week from OMB.
Yes, so there is one that has already been transitioned, and we are looking at additional sites.
How many locations?
As I say, one has happened already. There's another 1 to 2 under consideration right now, still under assessment.
Which location has already happened?
The Wingate Hotel.
Okay. How are savings anticipated?
So the H&H system primarily used contractors that were a bit more expensive than the DHS contractors. So by transitioning to the not-for-profit model that DHS typically uses for shelter, we are able to achieve some savings.
Okay, I think we're on the right road there. In looking at city contracting with nonprofit providers then, we all know that the city's robust landscape of nonprofit organizations provide community-based human services on behalf of the city to many of our most vulnerable residents. This is especially true for the Department of Social Services. DHS's contract budget totals $3.82 billion, which is over 90% of the agency's budget, largely relating to shelter services. HRA's contract budget is nearly $1 billion and includes programs such as domestic violence shelters, housing and support services for low-income individuals who are HIV positive, workforce development programs for cash assistance clients, and food to stock our city's food pantries and soup kitchens. Many of these nonprofits are struggling to keep their doors open, not only because the amounts they're paid under city contracts do not keep pace with the costs of providing services, but also because it's so challenging to contract with the city and because payments are typically received well after they have provided services, and that is a huge complaint time and time again from our providers. Nonprofits are forced to front large sums of money, which they often need to borrow at an additional cost to provide services. This is also coupled with the challenges of navigating the city's arduous contracting process. Many providers have expressed their reluctance to submit proposals for RFPs because they're simply afraid additional city contracting delays could put their organizations in an even more precarious financial position. And I think that everybody, all of my colleagues here have experienced this situation, which is in a lot of cases very dire for us. So what is DSS doing to expedite the contracting and payment timeline for nonprofit organizations, especially as it relates to DHS contracted homeless service providers who are experiencing excessive contracting delays?
Thank you, Speaker. Before I answer that question, I just want to correct the record. It's the Walcott Hotel, not the
Thank you.
Wingate. Sorry for my mistake. So DSS takes its financial obligations to contractors very seriously. This is feedback that we have heard as well and that we are paying very close attention to. And say across DSS, all but one of our FY24 contracts are registered, so that's something that we have been pushing very, very strongly. There is a multi-step process after contract registration, so providers need to activate their budgets and then submit invoices on a monthly basis. And all of that is subject to several layers of review by the agency. That is not necessarily a structure of our own creation, right? This is part of the overall city financial management process. We absolutely believe that the checks and balances are important to make sure that we're using city resources appropriately, but we're also aware that that slows down the payment process. So we are always looking for ways that we can streamline our internal processes. That includes, as well as process changes, that also includes training both for DSS staff, but also for providers. I think one of the challenges that we see frequently is that there's a lot of back and forth on the documentation associated with invoices. So the more that we can do to make sure that we are hitting all of the required documentation on step one, the better off we're all going to be. I think I'm probably not saying anything surprising. There's been a migration to Passport this year that has added additional challenges. I'm very confident in the long run that is going to make us all much better off, but recognizing that it has created some challenges this year, MOX and OMB have been very supportive of giving additional advances to agencies, so we have done that where we need to. But we continue to work closely with providers, do regular troubleshooting, and are looking for ways that we can make ongoing systemic improvements.
I agree. It's such a monumental issue with our nonprofit organizations, and we have to do better. We just have to do better. Does DSS have an accounting of all nonprofit contracting and payment delays?
Excuse me. I don't have anything right with me, but we can certainly circle back.
That's really important. If DSS doesn't have an accounting of these delays, of these nonprofits that are stuck in your log jam, that's an issue.
It's a little bit more nuanced because what one might consider, certainly not-for-profits would consider a delay when they have submitted an invoice and they have not been paid. Mm-hmm. If we don't have the required backup to go with that, from our perspective, we are still working with the provider to make sure that we are getting there. Prompt payment is really important, but so is that accountability and making sure that, when we're here answering questions about audits and accountability, that we have done everything that we need. So we're looking to strike that balance and looking to make sure that we are getting it right as quickly as possible, but recognizing that the definition of delay can sometimes be a little bit nuanced there.
So if the box isn't checked on the nonprofit side, then you're pushing it back and saying, well, okay, this isn't a delay as far as DSS is concerned because we've now pushed that.
I'm saying it is an issue that we need to resolve across the board, but we frequently see challenges where we are not getting complete documentation or where we potentially haven't gotten bids for subcontractors. It is our responsibility to make sure that providers understand what they need to do and that the process is as easy as possible for them to navigate. But under city rules, we're not allowed to make payments if we don't have all of that documentation or those bids.
Okay. What is DSS doing to ensure that city contract reimbursement rates are keeping pace with the cost of providing services and employing and retaining skilled staff?
There are several things that we have done. We look on an individual contract-by-contract basis. We are happy to work with providers on needs related to costs that they are seeing. Places where we have seen cost increases relative to our model budget are things like insurance, and we know that's an ongoing issue. We work through that on a case-by-case basis. Recently, within the DHS budgets, we gave providers some flexibility to realign some of their staffing salary levels so that they could recruit and retain staff better. And then there are always ongoing conversations with OMB about places where we think we need more systemic change.
Okay, thank you. Shifting a little bit and talking about fair fares, I was very encouraged by your presentation and knowing that the numbers are up, 310,000 or so. That's very encouraging. Fair fares obviously continues to be a priority for this council, and we were really happy that addition brought the baseline budget up to $95 million and expanded the program eligibility from 100% of the federal poverty level to 120%, which helps this vital program reach more city residents who need assistance with transportation costs. Just to get a little more insight into the program, I have the numbers, and I believe you said this, but when exactly was the expanded eligibility implemented?
November of 2023.
Okay. Can you give us a breakdown of the $95 million budget in the fiscal year 2024 by expense type?
It's a tax levy funded program.
Say again,
Sorry, it's a tax levy funded program, but maybe I'm not understanding the question correctly. I'm sorry.
All right, I'll ask a different one. What was actual spending? Let's go to FY 2023.
Got it.
Actual spending.
Let me pull that up. One moment.
Got an assembly line.
All right, yes.
That's good. Teamwork makes the dream work.
65 million.
65 million, okay. And how much of that went towards client benefits?
60 million.
Okay. Where did the rest go?
Marketing the program and the staff that administers the program.
Okay. What has actual spending been thus far in this year, 2024?
We will circle back with you on that number.
Okay. Assembly line's got nothing.
It's possible we'll have it before, but I don't want to hold things up.
All right, thank you. When or will fair fares actually go to the Omni system? Do we know?
We're starting a pilot with an Omni system this year. We're working very closely with the MTA on that. Certainly before the MTA transitions away from the MetroCard entirely, we will be in a position to be fully on cards.
But we believe it will be this year.
We're absolutely starting a pilot this year, yeah.
Okay. What types of outreach and education is HRA doing to ensure that all eligible individuals are aware of the program? That's been our biggest issue.
Yep. We do a lot of outreach. I'm going to start, and then I will pass it over to First Deputy Commissioner Barry. We do transit talk events with MTA. We promote it within the MTA customer service centers, promote it online, both through DSS online applications and with the MTA. But Jill.
Commissioner, I think you got a lot of it. We also do paid advertising in neighborhood newspapers, local language newspapers, advertising on bus shelters and in the subway system.
Okay, thank you. Do you see that outreach expanding further than what you're doing right now?
Yeah, one of the things we really spend a lot of time with on the outreach is looking at those zip codes where it appears that people are eligible and not enrolling in the program, and targeting the outreach each year to those specific zip codes and doing that, reevaluating that each year.
Okay, thank you. Thank you for your testimony. I may have other questions later. Madam Chair?
Thank you. Yeah, I'm actually hosting hours for folks to come in and enroll because I think one of my districts and Councilmember Yusuf Salam's district is also impacted in that way. So thank you for that. I have so many questions, guys. I don't know where to start. We're gonna be here for a minute. No. I had just out of curiosity, we've seen that there's been a significant increase in the number of applications for cash and SNAP benefits. What do you think is driving the increase? Because it seems pretty significant.
I think there's two primary things going on. First, during the pandemic, the federal government invested in a lot of anti-poverty programs, right? There was the enhanced child tax credit, there was enhanced unemployment, there was rental assistance. There were a variety of tools that we saw made a really significant difference in poverty rates, and then those have all been pulled back. And so I think what this is exposing, what we're seeing in the benefits application right now is exposing that pandemic recovery has not happened equally across every community. So that is a big issue. And a really serious one that we all need to be thinking about. The other piece of it, which is slightly more positive, is I think we really have lowered the barrier to application significantly, right? So it used to be that you had to physically go into a center. It meant taking a big chunk of time out of your day, getting on the subway. If you have kids, finding childcare, bringing them with you. For some people, there was stigma associated with that. Now you can apply from your own home online at whatever time is convenient for you. And I think lowering those barriers has also contributed to the increase in applications.
Well, I was pleasantly surprised by the number of folks that have been connected to employment, because I think you and I have discussed this. The applications and being accepted, approved for cash and SNAP benefits is an important step, but the long-term, right, ability to become self-sufficient is equally as important. And so I was happy to see that there were some restorations to the employment opportunities section of your budget. All right, so regarding the city FEPS and HRA's rental assistance program, so we're all aware that the city shelter system didn't just become overburdened in April of 2022 with the unanticipated influx of asylum seekers. Prior to their arrival, the DHS system was already strained. One of the proven strategies that the city can employ to address housing instability is the provision of rental assistance vouchers. The council has repeatedly called on the administration to increase baseline funding for city FEPS vouchers to align with actual spending more closely and to ensure that HRA has adequate staffing to support the efficient administration of vouchers. The council has also called on the administration to fund the HRA's budget to meet the requirements of the package of legislation that the council recently passed to expand voucher eligibility, which became effective January 9th of 2024. To date, no additional funding has been added to this legislation. Currently, how many individuals are enrolled in and using rental assistance vouchers?
There are about 38,000 households currently receiving city FEPS.
38,000. And I know that you mentioned in the beginning of your testimony that there were 1,000 individuals that were placed in permanent housing last year. Do you know how many of that 1,000?
So
that's for a voucher?
Yeah, just to clarify, the 1,000 are people who were individuals who are experiencing unsheltered homelessness. So it's a subset of the overall
supportive
placements.
housing?
Very interesting to me, actually, about half of them went to supportive housing, but close to half used city FEPS. So, that was surprising to me, but it's absolutely an option for everybody.
Okay, absolutely. How many additional individuals have been deemed eligible to receive shopping letters but are still residing in shelter while they search for an apartment or await approval?
There are more than 10,000 households that currently have a shopping letter, but are in shelter and who are searching for housing.
Okay. And a shopping letter is good for what, 10 months?
I
believe it's 10 months, right?
We'll get back to you on that one, probably before the end of the hearing.
Yeah, it would be nice to know how many, because is an individual able to extend it?
Yes, absolutely. So if a household continuing its eligibility, right? So a family with children, for example, on public assistance, working 15 hours a week, if their shopping letter expires, it will automatically renew.
Okay, it would be nice to know if you could get me the numbers of the number of times that they have been renewed for how many clients? And how many people currently on staff at HRA administer the rental assistance voucher program, and how many of these positions are vacant?
So there's a broad universe of people who touch the City for HEPS process. Starts at DHS, actually, for people who are in shelter, DHS has a team of approximately 100, and we will circle back with exact headcount numbers on each of these areas, but DHS has a team of people that work with shelter providers, review packages. HRA has a team of people, then there's everybody who cuts checks, but supported by our IT department, supported by finance. So there's a significant infrastructure that works on rental assistance. We will try and do a breakdown of all of those different areas and get back to you with that.
Okay, in regards to the budget, because I think that this comes up every single budget cycle regarding the City FEPS program, is the underfunded amounts that are presented as part of the preliminary and, even sometimes the executive budget. It seems like the administration usually estimates the cost of certain programs to allow some level of flexibility, but when it relates to the City FEPS program, it's usually always underfunded, and then the adjustments are made later. Do we know why that's the case?
So rental assistance spending is very dynamic because it's a function both of the caseload and how many people we enroll, and then also so that rent levels, right, as FMR goes up, which has gone up quite substantially over the last several years, and then also trends in income because tenants are paying 30% of their income in rent. So with that sort of three variable equation, it can be a somewhat difficult number to project multiple years out. We'll work year by year with OMB to make sure that we are putting the funding in the budget. There was a significant add this year, and the budget for FY24 is, I believe, $744 million for City FEPS, which is a record.
Okay. Regarding hold on, I'm just looking here to make sure. Okay.
Deputy
Yes.
Speaker, I'm sorry, it's 120 days for a shopping letter.
120 days? Oh, okay. But it was longer than that for some reason. I don't know where I got that from. Okay. The adopted budget of 2024 included a baseline reduction of $36.2 million for DHS's shelter service providers. Savings were to be generated from a 2.5% net reduction of shelter contracts, and were permitted to reinvest half of that, or 2.5% towards staff retention costs. At that time, DHS stated that shelter providers were not spending down all of the personnel service costs allowed in their contracts, and therefore the reduction would not affect providers. Providers, though, have stated that the only reason that they could not spend the entirety of their contract was because of restrictions placed on what they could spend the funding on. Where is DHS in the process of implementing this change?
Thank you, Councilmember. So just to clarify, this is a peg from the FY24 cycle, so from last year. Like all the other agencies, we had to take a peg to address the city's financial position last year, and because, as was noted, the overwhelming majority of our budget is passed through to not-for-profit contractors, we really had limited options, and we couldn't entirely hold our not-for-profit providers harmless. In the past, when we had to take cuts and we had imposed particular types of reductions on providers, what we heard back from them was they know their budget and operations better than we ever can, and that it makes more sense for them to have some flexibility in doing so. So the agency's cut peg for last year was 4%. We passed through 2.5% to the not-for-profits, and then gave them the additional flexibility on top of that to do some personnel realignment so that they were able to make some decisions that helped them. I think to the point that you speak to, we heard that some of the reasons that they had vacancies, right, was because salaries were low. So what we were saying is, yes, we need to take some of that as savings, but some of that can also go to increasing particular salary lines. And we thought that flexibility and individual contract management made sense for the providers. We have worked with every provider to come up with a series of changes that made sense for them. I think the bulk of them are in place at this point.
Okay. So we're hearing from the providers that the cut has been quite painful. And I'm assuming that because of the conversations that are ongoing, has that changed?
Cuts are unfortunately always painful in our area, or virtually always painful in our area. I think there's every once in a while we can find something where we're actually improving service delivery and saving money, but it's hard. We're providing essential services and serving vulnerable clients. I did not want to make that change. It was something that we had to do in order to meet targets, but we continue to work with individual providers to address particular concerns. There was at the same time the workforce enhancement funds that were added, so that certainly didn't make providers whole, and we understand that the intent there was to grow, but it did provide a partial offset.
Have the anticipated cuts, have they caused a reduction of any type of service or the elimination of any positions at CBOs?
So I can't speak to individual not-for-profit, individual shelter, how they have, whether or not they have reduced any headcount positions. Nobody was laid off, but we did think that there were some, I do believe there were some vacancy consolidations that was, spread out across our many hundreds of shelters, so I can't actually speak to the details. But I feel very confident that our providers are continuing to provide exceptional service. I think one of the measures that I take most seriously is the number of clients that we are connecting to permanent housing. We saw a 17% increase last year, and we're on track to exceed that this year.
I mean, I think that what makes this more difficult and, complicated is the fact that we're also not paying our contracts on time. And so any percentage that we're taking away from a budget that's already at a deficit, in the beginning of the fiscal year is problematic. And I think that that's, an argument that holds true. And considering that the actual baseline reduction is only 36.2 million, I mean, I don't, that doesn't, in the scheme of things, when I was little, I thought that was a lot of money. I know now better, and I know that we can find that, and I've seen plenty of new programs that have been announced in the last month that equal to, far more than that are new and necessary. But I guess in times when, we're struggling, we shouldn't probably be adding a whole bunch of new programs and services so that we can keep the ones that we have intact. But that's just me. Regarding the nonprofits, because one of the things that we passed a number of bills a couple of years ago regarding the security guards. Do you know if the nonprofits are using city money to fund security guards at transitional housing, and how are the how are they ensuring that the security and safety of the staff and much less the residents is intact?
Yeah, absolutely. All of our shelter contracts includes 24/7 security, so there's always on-site security that can be provided in a variety of different ways. In many cases, it's subcontracted out, but as some of our providers hire security guards directly, and they're part of the organization's direct payroll. We provide extensive training to not-for-profits in accordance with the laws that were passed. So we really spend a lot of time on making sure that security guards have access to the appropriate training. And then I think, as was noted earlier, we are funding the prevailing wage requirements as well on a year-over-year basis.
Okay. I know that I have another question on security, but I'll come to it. I'll get to it. Okay. The timeliness in the backlog. During the November plan hearing, the OMB director told the council that the SNAP program had addressed all the backlog, and that the administration expected the cash assistance program to be rid of their backlog by February. HRA has also stated that the agency has hired over 700 new staff to assist in making sure that the backlog was taken care of. The PMMR, which was recently released, reports that the timeliness for both programs has continued to be troublingly low. For the first 4 months of fiscal year 2024, cash assistance timelines reached a new low of 14.3%, and SNAP timeliness was at 41.6%. On March 4th, the mayor announced that the cash and SNAP backlogs had been entirely eliminated, nearly entirely eliminated. Can you explain to us how HRA defines backlog for cash assistance and SNAP, and does it relate to both applications and recertifications?
Yeah. Thank you, Deputy Speaker. So yes, the backlog includes any new application or annual recertification that's not processed within 30 days. And that's true for both cash and SNAP. I want to maybe take a minute to explain the distinction between what was in the PMMR and what we are saying now, because it certainly does matter. The timeliness rates from the PMMR, as you note, reflect the first 4 months of the year. Over the summer, so at the beginning of this fiscal year, that was our peak backlog, right? We were at 46,000 cash cases backlogged in July of 2023. And as a result, timeliness rates at that point in time were very, very challenging. As we are reducing the backlog, the timeliness rates are improving significantly. So for January, which actually reflect December applications, it was 55.4% for cash and 62.9% for SNAP. So still room for improvement there, but significantly better than they were in the PMMR numbers. Because the timeliness rates lag slightly, they're always calculated on the previous month, you should see much better numbers for when April is released.
Okay. And did that relate to both applications for applications and recertifications?
Correct. Those are combined timeliness numbers.
Okay. All right. And okay. So how did HRA clear the backlog?
Great question. I'm very happy to answer that one. I'm going to give the top lines, and then I will turn it over to Administrator French. So we really had a three-pronged strategy. We were focused on hiring staff, as I mentioned multiple times, close to 1,000 people over the last year for frontline cash and SNAP processing, investing in technology changes, and then doing some really significant process improvement, including waivers from the state. But I will let Administrator French give the details.
Thank you, Commissioner. So yes, as the Commissioner said, we took a three-prong approach that really worked together to get us to a place where we are operating as efficiently as we can. So aside from the staff, which we have been able to also hire throughout the hiring freeze, so we were able to continue to stay focused on having our eligibility staff to be able to take in the applications, work with our clients, and make assessments, through the use of technology and waivers from the state. We're able to look at processes that maybe didn't need to be done so manually, and or based upon information that we had, maybe we could look at a smaller subset of individuals who needed some efforts on our part, but could be receive some waivers as well. So one of those was on recertification. On a cash case, individuals get a 6-month mailer. This used to go to everybody. We, looking at our data, realized that usually only 9% or so of clients actually had earned income which needed to be reported at that 6 month. So working with the state, we were able to get a waiver for the 91% of individuals who didn't need to submit it because there was no change in their case. As you can imagine, that's great for clients, but also for our workload. We're able to refocus our staff on applications and recertifications that need actual work done, while not having them look at applications where there is no change, so the case would continue as is. So I'd say that's illustrative of the different types of ways we looked at it to improve the processes and make sure our staff are focusing on the cases that need our efforts, but for cases that didn't, clients would continue their benefits and staff could move on to the next case that needed some looking at.
So were the waivers that were approved, are those waivers that we used throughout the pandemic as well?
No, these are waivers that, many of them are waivers that we developed as we were looking at the backlog, we have a group of individuals both on the program side, the legal side, our accountability office, and our IT, constantly looking at the ways in which we're doing our work and identifying additional places where we may be able to streamline the process. So many of these waivers were a result of that. Additionally, another waiver we looked at and got agreement from the state was around selective case review for certain cases where usually supervisors needed to look at every case, but we were able to look at cases where we were able to waive the secondary review because the case itself, was going to move forward, and we had real confidence in that there were no errors related to the case.
Yeah. Are these waivers permanent? I mean, is there any opportunity to change policy here so that they do become permanent?
At the moment, the waivers are ongoing. We continue to work with our oversight, OTDA, as well as other oversights at the federal level as needed. We are not looking at this moment to stop any of the waivers. And so, as of right now, we are looking to keep them in place.
I mean, I ask because usually waivers are not indefinite, and we saw during the pandemic that they worked well, and then as soon as we no longer had them, we saw an influx of, in the number of backlog cases. So obviously, we want to make sure that whatever positive trend we're on, that it's something that, we can manage, right? And that's sustainable. So that's...
Yeah, we definitely, working with our partners at OTDA, are looking to keep the waivers in place. I will say also, in conversations with others around the state as well who are experiencing the same challenges as New York was as it relates to a high volume of applications and recertifications, and keeping up with that, they have definitely looked to us and asked us what we have done, and I know others around the state are considering similar approaches that we are. So it's definitely a partnership between us, and we are looking to keep these in place as long as we can.
No, I hope that you could, and I think that there should be long-term conversations with OTDA about just making a policy change so that the waivers are no longer waivers, but a matter of policy. Because a lot of the times, right, a lot of this work is really redundant and creates more bureaucracy than necessary.
Yeah, OTDA has been terrific partners in this, I think, and we will absolutely keep that open line of communication going. I think one of the small silver linings here is that we have found ways to make this process actually work better in ways that I think will make us more resilient going forward, and we certainly don't want to lose any ground there. Sorry, I do have to correct one more statement that I made, that PMMR timeliness rate is only applications. It doesn't include the recertifications.
Okay. Okay. Could you tell us what the breakdown for, so obviously we heard, both from you guys today and from OMB Director Jack Gihal last week, that HRA had hired 700 additional workers to address the backlog of cases in SNAP and cash assistance. Do you know what the breakdown is of the number of hires in the SNAP and cash assistance?
So just to slightly update the OMB number, we're actually at about 1,000 people for frontline staff within cash and SNAP. That is a great question on how that 1,000 breaks out between cash and SNAP. We will certainly circle back with you. In total on board, there are about 1,900 people working on cash and 1,200 on SNAP.
Okay, cash. All right. Is the is the rate of hiring keeping pace with the attrition rate in the agency?
Yeah, so we've had for those specifically 1,000 cash and SNAP frontline positions, we've had a net growth of 535, so we're exceeding attrition there.
Okay. And we're hearing from the city agencies that the city agency is still mandating overtime for workers. With the additional hires in HRA, why is mandatory overtime still occurring? So
we've significantly reduced our reliance on mandatory overtime. Every once in a while, when we get a particular spike for a given day or a few days, we will do some mandatory overtime, but at this point, virtually all of our overtime is voluntary.
Okay. What is the current timeline rate for the processing of new SNAP applications and recertifications?
So because we are at the point where our backlog is virtually eliminated, of almost all of the applications are being processed within the 30-day window.
Okay. Moving on to system improvements, okay. While we're glad to hear that HRA is working to resolve the backlog, we also want to ensure that the lessons that have been learned, and that we want to ensure that lessons have been learned and that the agency's processes have been improved in a sustainable way. What specific steps has HRA taken to improve processing of both cash and SNAP? I mean, you spoke about the OTDA situation. Has there been anything else?
Well, I think that the technology investments and technology improvements are really important. So I'd say the on-demand interview process is one that is really helpful, and that I think will make us more resilient going forward. And we have continued to iterate on that. So just to take us back to the beginning, the interview requirement is a federal requirement, something that you need to do in order to access benefits. For both cash and SNAP, but more recently for cash, that used to be a fully in-person process. You had to go into a center. We were able to bring that on the phone, but the original version was what I keep calling a "don't call us, we'll call you," and that didn't work as well as we wanted it to, because the times that we were making calls weren't necessarily convenient for clients. We were able to pivot to an inbound calling system so people can call us when they need to, added a callback function so that if somebody doesn't want to wait on the phone, that they are able to get a call back, but holding their place in line. And then most recently, we have added some verification procedures so that really only calls related to interviews come in on that particular phone line. Other inquiries are routed elsewhere, so that improves the efficiency and improves the client experience. So all of this sort of iterative process reflects the learning that we did, and I really do think that it's working much better now.
All right, so we've been hearing, I mean, this is all great, but we've been hearing from clients that it's really hard to get through HRA on the phone, and that we have seen reports of increased denial rates. What is the current denial rate for each SNAP and cash assistance, and how does that compare to pre-pandemic rates?
Sure, thank you. As of December, which is the most recent data that I have, the denial rate for SNAP was 52.8%, and for cash it was 64%. For SNAP, it's marginally higher than the pre-COVID rate, but it is about 33% higher for COVID. Couple of things, for cash. Couple of things that I want to point out here. First of all, as I know you're aware, right, we aren't setting the rules and regulations for cash and SNAP. These are federal benefits, and what we are doing is enforcing the state and federal regulations. But I also want to call back to what I talked about a bit in my testimony about lowering barriers to access, which is absolutely the right thing to do. But what we found is that many people apply earlier on in their journey, right? When you had to physically go into an office and deal with all of the complications of physically going in, people were much more likely to have had every piece of documentation assembled, to have really done their own personal calculation of the trade-offs and whether or not they were going to qualify for benefits. People now are much more likely to start the process early on. That's fine, but it does mean that there are fewer people who are completing their interview, and that is the primary reason for denial. I think this is very consistent with what you see in other kinds of government benefits, that when it's easier to access, more people start it, not necessarily more people complete it. And I think part of the reason why you're not seeing much of a change in the denial rate relative to pre-COVID for SNAP is that we had the online application for SNAP before COVID. For cash, it's really where the change is, and so that's why I think you're seeing that change.
So just so that I understand, people are starting an application but not completing it?
Correct.
Okay. And how do we know that they didn't complete it because they didn't, they were trying to get through, they didn't understand the application? Like, how are you gauging, right, that it's that somebody started the process too soon, or not that they had some sort of complexity completing the application?
Good question. We're doing a few things to make sure that that is not an issue. First of all, we monitor wait times on the phone very, very closely. For cash, wait times these days are typically between an hour and a half with, as I mentioned, a callback function. For SNAP, it's about half an hour, give or take. And we know that we are completing more than 10,000 interviews every week. So people are able to get through, and people are able to get through that process. That being said, denial rates are a concern of ours as well. So that we had our Office of Accountability do a review. We are continually looking at the cases that are denied to make sure that there is nothing systemic going on, making sure that there's no training need. Thus far, we really haven't seen anything that would suggest that there's inappropriate denials happening. And lastly, we're really investing in CBOs that are out in the community and providing some hands-on support with clients so that if they do need more help getting through the process, that they have that resource.
Okay. And what have you heard about this whole situation with the phone? Because I think that since I've been in the council, this has been like a constant, the complaints from applicants that they cannot get through on the phone. I mean, it just keeps coming up at every hearing, so I don't know that it's been resolved.
As I say, it is something that we monitor wait times incredibly carefully, and we will move staff around so that they are, if the wait times do seem to be creeping up, we will move people off of processing and move them to the phones so that we are making sure that wait times are staying balanced. Consistently on the cash side, an hour to an hour and a half. That's not a short wait time, but it is shorter than when people were going in person. And as I say, we do have that callback function. I would encourage you, if you have specific people who are saying that they can't get through, if you could share names with us offline, that would be really helpful. Sometimes reverse engineering can help identify if there's an issue. But Administrator French, anything you want to add?
Commissioner, I think you did get it, and I would just say, every morning the team looks at where the needs are, and they will move things around. So if there is a high phone call volume, they'll move more staff there to keep the wait times within the hour and an hour and a half. But it's definitely something that we look at consistently and look at to find any trends that might be there where we need to dig a little bit deeper. But I would emphasize for both you and others in the community, if there are specifics where individuals are having challenges with the phone, it is good for us to know that so that we can also look on our side to see if there is some type of issue we just weren't aware of.
Okay, well, since I have you, there were some similar complaints regarding the system that is used to complete applications. I forget the name of it. Gail maybe remembers because she remembers everything. But we had a hearing where we heard from some of the staff that they had you transitioned during the pandemic to a new system that was then, I guess, put on hold during the pandemic and then reinstated once folks were back in the office. But there were glitches with the system. So if a person was doing an application, it may have frozen, they couldn't fix it, and so they had to move on to another applicant, and they didn't know what happened to the applicant they had been working with. Like, there was no way of determining, who picked it up at what point. What changes have been made to that system? Since technology is like one of the models that you're using to help expedite the processing of applications.
Yeah, so this is the SPAS and the ANGI systems that yes. And those are specifically the systems that we use to process the SNAP-only applications, not the cash assistance applications. We re-rolled out ANGI and SPAS in March of 2022, and we have since upgraded. That was version 1.0 of ANGI. And ANGI has since been rolled out to version 2.0, and that addresses, I think, a lot of the issues that staff were having. There are always some bugs as we roll out new systems. We do listen to staff concerns and complaints and do iterate on those systems. A couple of things. One was there was an ask to speak directly to the staff about their experience with the systems, and we worked in partnership with the Mayor's Office of Efficiency on work groups with the frontline staff that use these systems to talk through what are the pain points both in the systems and the processes. We came up with a list of corrective actions so that we are in the process of implementing those to improve both the process and the systems.
Okay. I'm going to try to run through these really quickly because I know that we have a bunch of questions from some other members, and I don't want to hold them here longer than I have to. But regarding the funding swaps, the preliminary budget plan includes an additional $500 million of city funding in each fiscal in each fiscals 26 and 27 to support asylum seeker response efforts. In addition, the plan also includes a swap of city funds for state funding with no net change to DHS's budget. $220 million in fiscal year 24 and $750 million in 25. How were the amounts added in fiscal year 26 and 27 determined? And as of the preliminary plan, all of the asylum response funding in fiscal year 26, well, actually, let me just go back to the first question because I don't want to conflate the two. How were the amounts added?
So I will start and I will pass off to Chief Levine. There's a lot of uncertainty in the asylum space here, right? I think the one thing that we can say has been constant over the last 2.5 years is the pace of change, right? That is the pace of people coming in, the breakdown between families with children and single adults, particular needs. We've had to adapt a number of times, so I would say there is a fairly high level of projection going on here, and that we will need to continue to iterate and adapt the asylum seeker budget as we know more about how things are actually playing out on the ground. But Chief Levine?
Thank you, Commissioner. State funds were added, excuse me, in anticipation of the state reimbursement that we have been achieving in our budget. And we added the $500 million in each of the out years in anticipation of city costs that would continue through that period.
Okay. So as of the preliminary plan, all of the city's asylum response funding in fiscal year 26 and 27 is budgeted through DHS. Do you expect that DHS will assume full responsibility for response efforts by that point time, or will some of this funding be transferred to other agencies?
Yeah. The first few months of the asylum seeker crisis, DHS was really very much the lead, and it was a tremendous challenge for the agency, right? We have responsibilities, as does every agency, right, that go well beyond the asylum seekers. So at this point, the asylum seeker operation is a whole of government response, and I do anticipate that to continue. And funding will be aligned as appropriate.
Okay, and given that the state and the city budget were released simultaneously this January, the funding swap made in the preliminary plan was made assuming that the level of state support the city would receive. If the state budget is enacted as proposed, what changes does the DHS anticipate it will need to make in the executive plan to accurately reflect the amount of state funding in the DHS's budget?
We're going to have to work with OMB to determine what's happening with the state budget, what's happening not only with our budget, but with all of the other agencies that are serving asylum seekers, how the pace of claim is going, anything that's happening with the federal government. So with the number of variables going right now, I feel like it's too early to answer that question, but happy to circle back as we know more.
Okay, and regarding the contract that providers the DHS is working with for asylum response nonprofit, are they nonprofit organizations?
Virtually all of our shelters either are or will be operated by not-for-profit organizations. We have grown much faster than the not-for-profit sector can staff up. And so we are very grateful to have National Guard who are staffing still some of our sites. I think roughly 50 of our asylum sites are still largely staffed by the National Guard. But our model is to transition to not-for-profit providers over time. It includes many of our traditional not-for-profit providers and many new organizations that have stepped up to work with us in this moment.
How many are run by the National Guard?
It's approximately 50. We can circle back with the
50?
exact number. Yeah.
Okay. Any for-profit organizations?
I believe there are 1 or 2 sites that are operated by for-profit organizations. Again, we can circle back with you on the specifics. All of them have responded through our RFP. Everything that we are doing in this space is competitively procured.
Okay. And can you provide an estimate of how much of DHS's budgeted asylum seeker funding relates to contracts with for-profit providers? assuming if it's.
I don't have that number with me, but we can circle back.
Okay. And does DHS permit providers to subcontract with for-profit organizations?
So it's very standard within our shelter model that not-for-profits will subcontract with for-profit vendors for things like food and security, sometimes maintenance, and that is true within both our traditional and our asylum portfolios.
Do you have any idea if the security funding is going to be baseline this year?
We are in ongoing conversations with OMB about the security funding.
It's local law. It's been local law for years. It's not going away. Okay, let's see. We would like to discuss the population of asylum seekers currently in DHS facilities. How many asylum seeker households and individuals are currently in the DHS shelter system?
It's just over 30,000 individuals. The vast majority of those are families with children.
Okay. Emergency hotels. How many emergency hotel shelters has DHS opened to house asylum seekers?
Hold on, let me pull that up. We have 163 sites in total that are DHS asylum sites. Not all of those are hotels, however, so majority of those are hotels, but there are a handful of others, so let me pull that exact number. Or in the interest of time, I can circle back with you.
Okay. Okay. Has DHS closed any emergency shelters since the influx began?
There are certain sites that yes, we have closed generally because of real estate issues. Either the site owner has pulled back, or we have decided that for whatever reason the site owner isn't meeting their obligations, either for quality or rate. But we have, generally speaking, over the last 2 years seen us growing to, at best, steady state census for asylum seekers, so we have not been reducing our overall footprint for asylum.
Okay. I'm moving on to the community food connection program. So obviously this is a vital resource providing much needed food to the city's vast network of food pantries and soup kitchens. This program is especially important given the current number of asylum seekers in the city who are not eligible for many public benefits programs. As of the preliminary plan, there is a $57 million budget budgeted in fiscal year 24 for HRA's community food connection program. This drops to just $25.8 million in fiscal year 2025, and then $20.9 million in fiscal year 26 and 27. That's a pretty substantial reduction. How will this program continue its current operations without additional funding added in fiscal year 25 and beyond, especially given both the increased need in the city and the higher cost of food?
We're really committed to the CFC program, absolutely recognize the vital role that it plays in communities, and we're working very closely with OMB on the out-year funding.
To add additional resources?
We're coordinating to make sure that we're able to move forward with the program at the appropriate level, yes.
Is there currently a wait list?
So the way the program works is that we make allocations to individual food pantries and community kitchens, and they, for an annual basis, they then place orders for groceries through our centralized vendor. So there isn't a wait list for funds because we've allocated out the year's funds for providers. I suppose it's possible that individual food pantries or community kitchens would maintain a wait list, but that wouldn't be something we're directly involved in.
All right, but if the CFC providers need more food than they have been allotted for, what is the process and the time frame for them to get approval to order more food?
I'm going to ask First Deputy Commissioner Barry to speak in.
So we are now monitoring and providing food pantries with monthly reports on their allocations so that they can see how far along they are in their allocation process, whether they're spending over or under their allocations. We do reach out to those providers that are either under or overspending to understand. Sometimes there are reasons for that. There may be other funding they receive later in the year, so they're using up their CFC allocation until that is available. So that is one way that we're monitoring it. The other thing we do is, as the fiscal year comes to a close, we're looking at what the allocations are that are left. If there are pantries that are underspending and they confirm that they will underspend for the year, we take those funds and we reallocate them to pantries that are in need of funding. And that happens towards the end of the fiscal year, so that'll happen in about May and June.
Are there food pantries that are underspending? I mean, I don't know. I think in my district, I've seen a significant increase, and we've actually been very purposeful here in the council in ensuring that we didn't touch any of our food network funding, because we understand that the need has increased, especially in communities that have seen an influx of asylum seekers, because they just don't like the food that is being served to them at the shelters, or don't find it, to be enough to sustain them. So yeah,
it's not typical to see a lot of underspending unless they are holding on to their CFC allocation because they had another allocation that they needed to spend sooner, whether from private donors or state allocation or other. But it is something we look at.
Yeah, I don't see, and I know that, hey, listen, these are decisions that are made, but I don't see how we would ever could ever justify a such a significant budget cut to such an important program that is ensuring. I mean, I'll tell you that the lines in my district are so long. They're so long, and I just assumed that after things stabilize after the beginning of the pandemic, that the lines would become smaller, and they've only grown. So that's pretty consistent with what we're hearing from you as well today regarding the increased number of applications for both cash and SNAP applications, right? Is that there's a huge demand for these services, and that's why it's very difficult to comprehend why there would even be a discussion about cutting those. I think the only way to really help eradicate poverty is through workforce development and ensuring that folks have the infrastructure to again become and stay self-sufficient. And unless we're equally applying funding to those, to meet that need as well, then we're going to continue to be on an upward trend. And if that's the case, and we're not committing the dollars to, workforce development or other viable options, and I think that there has to be a bigger conversation about why we shouldn't be cutting these safety net programs that are keeping people fed. That's a really, really big deal. In the preliminary plan, there was also a baseline savings of $3.2 million starting in fiscal year 26 from the We Care program efficiencies. We Care is a program that serves cash assistance clients with a medical and mental health barrier to employment. The program provides individuals vocational rehabilitation services to help engage them in work-related activities that lead to employment. HRA indicated to us that they will be exploring other city resources to provide this programming. How was the funding amount derived, and how will the savings be generated?
Thank you. So the savings generated for We Care, which will start in FY26, will align with a new contracting cycle that we will be doing. And as part of that cycle, we are looking at ways in which we can achieve greater operational efficiencies through the use of technology that better mirror the current job market, looking at ways in which we have flexible delivery models, using hybrid models that will be able to achieve some savings around things such as space, but doesn't actually compromise the programmatic priorities of We Care. So programmatically, we will still stay focused on employment and connection to employment for those with certain barriers, as well as vocational education and training for those who maybe need a little bit more training before they can join the workforce, as well as wellness supports for those who maybe have a short-term medical or mental health issue that's untreated that needs to be addressed first before looking at employment, and then for those who have long-term barriers to employment, connecting them to federal benefits such as SSI. So the savings that we identified are really focused on operational savings through the utilization of technology and some other program streamlining, including partnerships, but is not anticipated to make any programmatic impacts in regards to the priorities of the program. It's just better leveraging what we can now utilize in the post-COVID world.
So I'm assuming that because of that answer, that, the way that you responded to that question, that the funding cut is not going to impact operations for the program.
Correct. It won't impact programmatic operations for the program. There may be the other savings may be found through the utilization of maybe less space, because utilizing a hybrid model, right? You'll be doing many things. Will be a balance of in-person as well as, online or in partnership with partners who maybe can utilize their space. So we were looking at savings along those lines, but still providing the same level of programmatic offerings to our clients.
Okay, and are these services currently being provided by contracted providers?
Yes, they're currently being provided by existing WeCare providers whose contracts will go through June 30th, 2025.
Okay, so have they been notified?
Yes, contractors are aware that a new funding cycle will be coming and that an RFP will be forthcoming.
Okay, and is the funding cut from HRA's budget the full cost of the current operations for these programs?
I would turn the funding support. It's in our budget, but I think it is a mix of both.
But just to clarify, the WeCare budget is on the order of magnitude of about $58 million a year, and so this reduction is a relatively small share of that. Because it is only applicable once the new contracts go into effect, none of the existing contractors are losing money from their budget at this time.
Okay, is HRA advocating for this cut to be restored in the executive?
We are always talking to OMB about our budget as a whole. Certainly, as I said, given the very narrow window of discretionary city tax levy in our budget, the places where we had to look to make cuts were narrow, and we had to make some difficult decisions.
Okay, and my last question is, Commissioner, you mentioned that after that the shopping letters expire at 120 days, and the renewals are automatic. Are they automatic? I don't know.
So for somebody whose eligibility has just been maintained, so they were sort of base eligibility criteria on public assistance, working more than 10 hours a week, that will be an automatic renewal. If it was under one of the exception categories, that will require the agency to take some action, assuming they still maintain those exception categories.
Okay, because according to the policy bulletin of 2021-009, shopping letters are not automatically renewed. Is there a subsequent overriding policy bulletin?
So it's not automatically renewed if your circumstances have changed, right? So the fact that you had a shopping letter yesterday doesn't automatically mean you have a shopping letter today. But if you would have qualified for a new shopping letter because you are still meeting all the eligibility criteria, then it will be renewed for you. You as a client don't need to take action. So I think it's, maybe we're using the word automatic differently, but in that we are going to re-look at the eligibility criteria, but assuming you meet them, it does happen.
Okay, all right. I'm going to leave it there. I just wanted to note that I did see, as part of the PEGs, 2 of my Jobs Plus sites have been identified for cuts. Bronx Works in the South Bronx and Urban Upbound in East Harlem. I am obviously very concerned about that. Again, I have some of the highest rates of poverty and some of the highest rates of gun violence, and these programs have been, really great at capturing groups of folks that normally wouldn't know where to go to find employment, and they go way and above. They're not just finding you an apartment, but they're also following up, and they are ensuring that you have transportation and that you're filling out your applications properly. There's a lot of hand-holding that goes with the services that they provide. But I'm curious, were those the only 2 that were identified for closure, or because I saw there weren't that many?
So, thank you, Deputy Speaker, and certainly I understand where you're coming from and have heard the feedback. Those are the only two Jobs Plus programs that are funded directly by HRA. The others are through YMI. So we did, in this spirit of unfortunate and very hard choices, given our limited discretionary tax levy, did make cuts there. We are pivoting to focus on all of our borough-based employment models because it is a way to make sure that we are continuing to connect people to employment services, because I absolutely agree with you that workforce development is critical. It's a way that we can continue to do it while also meeting our financial obligations. People who are participating will be able to get access to Metro cards, so that won't be a responsibility for them. And we are working on an outreach and notification strategy for clients.
What do you mean by employment, borough-based employment model?
So we have a number of other contracts for employment services. Most of them are oriented rather than at a specific, NYCHA development, the way that Jobs Plus is. They have a broader geographic range, and we're focusing on those because it does allow us to provide the services more efficiently. Again, not a decision that we wanted to reach, but given that 90% of our budget, tax levy budget, is spent on entitlements, are the areas that we had to look were very, very limited.
So if I live in East Harlem or the South Bronx, where am I traveling to obtain this level of service?
We can certainly circle back with a list of the closest sites.
I mean, this is one that I, plan to make a big deal about because of the, the need in my community. I have a really good working relationship with both of these organizations, and I know how hard they work in our communities to make sure that they're working with, some of the folks that are, likelier to get into trouble if they were not engaged in workforce opportunities. But it's an opportunity. It's often the case that the neediest of people, we have to travel, outside of our communities to receive these services. We were supposed to get a workforce development site that was actually promised through the rezoning of East Harlem, and we're recently told that that was taken away, but that our constituents could go into Harlem workforce and utilize their resources. The idea of asking for that as part of a commitment was because there was a need. There was a huge demand for that level of service to be provided locally within the community. So to lose that and to now have to hear that both Jobs Plus programs will be, leaving as well, will be closing, we're going to lose that resource, is really, quite frankly, annoying and heartbreaking, because I know how difficult it is. I don't think that the city really understands how much stress it is. It seems very simplistic to grab a Metro card and just get on a train or get on a bus and go from place to place, but it becomes troublesome. It's hard, and these services should be in the communities that need them. If you have a high, the same thing, if you have a high rate of evictions, those eviction services, right, prevention eviction services should be in that community. If there is a huge demand for food, you have a larger demand for applications for food SNAP benefits in a specific community, then you should be purposely integrating yourself into that community. So I don't support those cuts, and I will not be supporting those cuts, and I'm hoping to see full restoration, because I know that these programs and services are essential to both the South Bronx and East Harlem, and I cannot just allow that to disappear. So with that, thank you. We will I want to recognize that we were also joined by Councilmember Brooks Powers, Ressler, and Brewer, and I think that our speaker has a follow-up question.
Just a quick follow-up, and I emphatically support everything that the Deputy Speaker just said. Resources in the community are essential and should never be taken away from those that need them the most. I just wanted to backtrack because I needed clarification on the emergency hotel shelter situation, and I don't think that I really heard that. How many emergency hotel shelters have been closed since the influx began?
I will need to circle back on an exact number. It is a handful of hotels that have been closed, if in the order of magnitude of a half dozen, and the reasons we have closed them is because there was some issue with that particular site, right? In some cases, the owner decided that they no longer wanted to work with us, or we found that there were physical violations, other kinds of things that meant that we didn't think it was appropriate to continue using the site. In those cases, we've found other placements for clients, so we are not downsizing our footprint at this time to serve asylum seekers because we have ongoing need. Of our total asylum sites, we have 162 total, all but 7 are hotels.
Okay. Is there a breakdown by borough for us?
I can certainly do that. I have a breakdown by borough.
And by type as well?
Okay.
It's all
I have that crosstab. It's a lot of numbers. We will send that over to your office.
That's really, really important that we see that.
Yep, absolutely.
Okay. Can you provide a per diem cost breakdown of each shelter, housing type, or broken down by asylum or non-asylum?
Yes, absolutely. So our overall per diem numbers, so these are our macro level. For single adults, the average per diem is $145.13. For adult families, which is any family composition that doesn't include a minor child, it's $243.51. And for families with children, it's $232.40. The overall asylum per diem, and this is a citywide asylum number, is, I believe, let me double check that. It's $388 is the overall asylum. That is inclusive of both the DHS system and the HERC system.
And the HERCs?
Yeah.
Do you see those numbers changing at all?
I absolutely think that we will see changes in the asylum number as there is a push to manage costs down. I think what is most important for DHS in terms of managing our overall per diem numbers is making sure that we are focused on siting long-term shelters rather than using hotels. Commercial hotels are an incredibly expensive way to provide shelter. It is why, separate and apart from the asylum crisis, that we have a pipeline of shelters and continue to open shelters, even though our goal is to reduce the size of the shelter population. It's really important that we take action to get out of hotels even before the asylum crisis.
Preaching to the choir, Commissioner, preaching to the choir.
Even before the asylum crisis, we were in something like...
Even before the asylum crisis.
5,000 hotel rooms.
Absolutely
and
right. This has been a clarion call for particularly Southeast Queens and my district for decades.
Yes. So we'd made real progress. We had all the families with children hotels closed. We obviously had to take a big step back from that progress, which is very unfortunate, but we remain really committed to it, and we are continuing to site and open new high-quality shelters in buildings that are really designed to meet the needs of both communities and of people experiencing homelessness. They are better for clients, they're better for communities, and they're less expensive. We're committed to that.
Agree with the movement from hotels. Overall goal will always be to get everyone into housing.
Absolutely.
Thank you for your testimony, Deputy Speaker.
Thank you. We've also been joined by Councilmember Rivera. We will now hear from Councilmember Brooks Powers, followed by Councilmember Riley.
Thank you, Madam Chair. I'd just like to follow up on the speaker's questions regarding fair fares. And I'll just ask them all together, and then you can respond. And then I have one regarding EBT fraud. So as it pertains to fair fares, are you able to provide an update on what the current uptake rate for fair fares is? How many New Yorkers are signed up as of today in terms of eligible New Yorkers? And then you mentioned $5 million was spent in fiscal year 23 on marketing and staffing for fair fares. Have you studied which avenues of distribution are most effective, as in what are the most effective ways to get people to sign up? And do you believe that additional, and also I'm just curious, you mentioned that there's been some outreach done around that, but in particular, where the household income levels are lower, has it been done in a strategic way to reach those communities? And I'm curious as to what particular outlets in terms of newspapers or radio stations have been invested in for that. And then you talked about the coordination with MTA on fair fares, about an Omni pilot, and also the distribution at MTA's customer service centers. Can you talk a little bit more about how DSS and the MTA coordinate on fair fares? What does that partnership look like? Do you have any data on how successful the MTA's outreach at their service centers has been? And I'll close with the EBT fraud, as I mentioned. So in Rockaway in particular, we've seen a spike in recent years in reports of welfare fraud. New Yorkers are being victimized by skimming. For example, their EBT card information is stolen and copied and then used by someone else. Can you talk about how DSS is seeking to address EBT fraud? What kind of outreach has been done to educate New Yorkers about EBT fraud? And I will acknowledge that you have sent out communication in terms of trying to recoup some of those dollars. I'm interested in how successful it's been. Again, we've had a uptick in terms of complaints about that, and there have been concerns and complaints about the local office that's in Far Rockaway and the support that they're able or not able to get there. Thank you.
Absolutely. Let me start with the skimming questions, and then between the team and I, we will answer the fair fares question. So, I mean, skimming is just terrific. It's people preying on the most vulnerable. Really something that we should all be ashamed is happening at all. Thanks to changes in state law, we are able to do reimbursement now. We have thus far approved a total of $21.6 million in replacement benefits. Majority of that is SNAP, but that includes some cash as well. The deadline for making retroactive claims, so this was before the change in state law, has been extended to April 1st, so there's still a little bit of time to submit those, and then people will still be able to do claims on an ongoing basis if they detect fraud. We have been trying to communicate that as widely as possible, so really pushing that out, but if you have particular places where you think we should be engaging on that, we're happy to collaborate. We are processing those centrally through DSS rather than doing it at individual site offices. We wanted to do it that way because we needed to be able to walk and chew gum at the same time, right? We had to make progress on our cash and SNAP backlogs, making sure we're getting benefits in people's hands, and we needed to be processing the skimming. So we did a little bit of dividing up of our work of labor, but we have, I think the process has gone, we've been able to move very quickly and with far less impact on other operations than I was originally anxious that we would. I think the best option in terms of longer-term solutions to skimming, because I heard that as part of your question as well, is making sure that the cards are chipped. That is something that the state is the one actually issuing the cards. So something we're in conversations with OTDA on, and I know that they're looking at. On fair fares, let me get it started, and I will pass off to colleagues. As of the beginning of this month, we had 317,300 people enrolled in fair fares. So not all of them are using fair fares on a regular basis, but all of those people have access to it. We've tried a lot of different things on the marketing, some of which we talked about already. We're partnering with, but in addition to what we've already talked about, partnering with a slew of other agencies and training their staff so that whenever they're engaging with people in communities, that they are able to enroll people in fair fares and to talk up the program. That includes almost 100 DOE school-based staff so that we're trying to really meet people where they are and marketing it as well within the various asylum facilities, because immigration status is not a requirement for receiving the benefit. We're distributing promotional materials in libraries. ACS has shared out materials, right? So we're really trying to go with a lot of different options, but Scott or Jill, either of you would like to chime
And are
in?
you doing them in multiple languages as well?
Absolutely, yes.
Yep, just a few more things on some of the targeted outreach we're doing, and then the pilot with the MTA is we reassess every year before we start our marketing campaign those zip codes where we know that there are people who are eligible and not enrolled, and we target the outreach in those areas, the bus shelter ads and the community marketing in terms of community newspapers and all that. We target those to those, specifically those zip codes where we know that there is under enrollment. We have robocall and text and mailing outreach to those of our clients that we believe are eligible and not enrolled. So we're targeting those specific individuals. And where we have found a lot of success, the things that have been the most successful are those partnerships with the MTA. So that's where we are meeting those people who are using public transportation and letting them know about fair fares. So those transit talk events, those customer service event partnerships that we do with the MTA, we generally see really good enrollment numbers after those. We are working really closely with the MTA on the rollouts to Omni. We want this to go as smoothly as possible for the fair fares population. We've started outreach to some of our fair fares participants to participate in a small pilot of about 50 people so that we can make sure that we are designing a transition and a system that works well for our clients and that none of our clients are left behind when we do the transition from MetroCard to Omni.
Thank you for that. And Commissioner, I will take you up on an offer in terms of collaborating. If there's a flyer about the EBT that we can share, if you could send it to the council members. And then I'll just close by us requesting a breakdown of the local ethnic media that you all are contracting with, in particular for my district. So we have like the Rockaway Wave, we got Where It's At Media, and a network of hyper-local press. I have not seen any advertisement about fair fares in any of this. So I'm just curious in terms of what that outreach looks where there's a lower household income. Thank you, Madam Chair.
Thank you. Councilmember Riley?
Thank you, Chair Ayala. Just a few questions. First, on economic stability. Love the programs that you guys are doing. One thing I did not hear about is the ID NYC cards program. So the admin's goal of supporting family transition out of emergency shelters requires pathways for jobs and housing. That starts with having a proper ID first. Additionally, domestic violence and disaster survivors rely on the ability to provide new ID for them to get their lives back on track. So with that being stated, how many ID NYC cards were awarded by HRA in FY24 to migrant shelter residents? How many do you expect to award in FY25? And how many applicants did not receive NYC IDs in FY25 that applied?
Thank you, Councilmember. So we currently have more than 2 million people have been issued ID NYC. It's about 2.2 million. Do I have the annual? We can get back to you with how many each year, but it has grown steadily over time since the program was originally launched. We are promoting it across a variety of different ways. We are doing work in specific asylum sites, but we are also making sure that New Yorkers of all backgrounds have access to the card as well. Let's see. In terms of how many were denied, generally speaking, people are receiving the card, and we are happy to work with people if they don't initially bring the documentation that's needed to access the card. Rather than just reject them, we will defer the application and work with them further. But Administrator French?
Thank you, Commissioner. I can say that for IDNYC and FY24, we are ahead of where we were in FY23 year-to-date of the number of cards distributed, so we expect to exceed that For context, in the first 6 months of FY24, there were a total of 92,000 new IDNYC cards distributed compared to 89,000 in FY23. We also saw a significant spike in increase in people looking for the cards, and that did result in, for some sites, having large numbers of individuals line up outside early in the morning. Some of them also lined up overnight. Much of this we found was connected to misconceptions around what the IDNYC card can and cannot do for you as it relates to someone's immigration status. We agree that a ID card is very important and essential, but there was definitely misunderstandings in regards to the card being a tool that was useful in your asylum application, which it was not. So we worked closely with our partners at Moya, as well as some other community partners, to make it clear what the ID could and could not do. And then we also looked at ways wanting to protect the health and safety of individuals. We moved to, at the end of January, an all appointment system for IDNYC, which actually allowed us to maximize the number of appointments we could provide. So every Friday in the afternoon, 6,800 IDNYC appointments are released for the following Monday through Friday. And so in working with Moya and community partners, as well as our partners at H&H, HPD, and NISM, we have done intensive outreach to the asylum-seeking population around the card itself, how to sign up for an appointment, either online or through 311, and we have found that
I don't want to think, but I have a lot of questions, and if I may, Chair. What was the total spent in FY24 on emergency shelter medical services? And did the administration discuss exploring partnerships with urgent care sites such as City MD or any other community medical providers to subsidize costs?
So some of our emergency shelter sites have on-site medical. Others of them entirely depend on partnerships with community sites. I think we will likely need to get back to you on the total spending, because those are going to be line items within individual contracts, so it's going to take some work to pull. But absolutely, partnerships are really important. One of our pegs in the plan this year is to make sure that we're using better use of the H&H show vans for providing medical care at drop-in centers.
Thank you. The remaining $1.3 billion DHS contract budget provides service to homeless individuals, such as emergency housing, outreach, food counseling, medical aid, and other support as needed. What is the total that is being directed to emergency housing, and is this outlined by intended use, land procurement, or facility upgrades?
So the vast majority of our shelters are contracted, and the contract budget is inclusive of the real estate, the staff, the food, the social services, maintenance, the entire thing, right? So individual contracts have line item budgets, but the city's budget is broken out: families with children, single adults, adult families.
Thank you. And just two more questions. The preliminary plan includes an additional $46.5 million in fiscal year 2024, only from the city and state funding sources to meet increased demand from HIV and AIDS Service Administration, single room occupancy, emergency shelter units. Based on January's PEG plan submitted by HRA and the RFP for the RISE program provided vocational services for HASA, clients will not be renewed. This program was administered by CBOs, but HRA's estimates this change will bring savings to the bottom line. For HASA clients, that will mean an immediate end to the workforce development program effective by FY25. So what is the plan to support CBOs who have historically done this work and are impacted by these PEGs?
Thank you, Council Member. So just to be clear, the new need was specifically on the bed side of the operation. So within the HASA program, we do both emergency and slightly longer term tier 2 shelters. And so we will be investing in, sorry, not tier 2s, but HASA emergency housing, we will be investing more money there, so the funding is there to make up gaps in those budgets. With respect to the employment contract, which It's a challenging one. As I noted before, close to 90% of our tax levy budget is spent on entitlement programs. So when we were looking for options for cuts, we had very few options. Most HASA clients are eligible for all of our remaining employment services programs. We do have a significant range of employment services programs, so we will be making referrals for clients to the other programs. But Administrator French?
No, that's what we'll be doing. We'll be connecting before the program ends with all of the clients for the RISE program, and we will be connecting them to local career services programs or other programs they might be interested that we currently run and that can provide them employment supports.
Thank you. And lastly, the subway safety plan. Could you give me the total budget for the subway safety plan? I know that $16 million was added in fiscal year 2024. Do you believe that this plan has been effective? I just read an article that was just released today. I believe it housed close to 380 homeless individuals who were sleeping on the subways. Do you believe it has been effective since it's been implemented in 2022? And how has the governor's plan to release the National Guard interfere with the subway plan? I took the train here from Baychester today. The entire subway was full with people sleeping on it. And I didn't see any outreach worker or anyone, trying to help them out. And I did see a lot of individuals who were coming on the train speaking very horribly about these individuals. So I just want to know, do you believe that this plan is successful? If you could just give me some numbers. And that's my last question. Thank you, Chair.
Thank you, Councilmember. Some really important issues that you raised there. So people who are experiencing unsheltered homelessness have been failed by every level of government, all parts of society, right? They've fallen through every crack there is to fall through. And working with this population and addressing that is something that is, incredibly challenging and goes well beyond just DHS. So one of the things that I think is really most important about the subway safety plan is that it brings together DHS, DOHMH, H&H, MTA, NYPD, a host of other agencies really thinking more comprehensively than we've done in the past about meeting people's needs. I think there's a lot of really positive indicators. Just to read off a few statistics, we've had more than 394,000 engagements, almost 7,000 unique individuals placed either into shelter or what we call our low barrier beds, safe havens and stabilization beds. And 397 people who have been permanently housed, right? So they now have a lease, an apartment, keys. It's really challenging and really iterative work. So, with some of these individuals, it's going to take, dozens or even hundreds of points of contact, right? That's why 394,000 engagements translates into 7,000 placements. Because these are people who, as I say, have been failed by everybody. I'd also say that we're seeing real success. We are absolutely getting some of our most challenging cases indoors. One of the things that we do is work very closely on really specific individuals, and we know that the specific individuals that this cross-agency group is focused on. We're seeing really strong success rates of getting people indoors. It's also not entirely a static population, right? As somebody is released from the hospital, as there is, whatever the next crisis in their lives is, the next person has failed, right? They become our next client. So we are going to continue working at it. I see a lot of indications of success, but it's also not going to be something that's solved quickly.
And the total budget?
Slightly difficult question to answer because it does cross so many agencies. There was about $170 million a year added to the DHS budget, but that builds on what we're doing already and what we're already doing within the subways, what we were already investing in low barrier beds. So that is a piece of it, but really, and that's what was added as a result of this initiative, but I wouldn't say that's the total spending, because it wouldn't be possible without the baseline budgets of DHS, DOHMH, everybody else.
Thank you.
Commissioner, if I may, could I just add one thing? It would be remiss of me if I didn't. As a social worker, just really amplified the 397 individuals who actually ended up in permanent housing. There were 394,000 contacts, but our goal is to have folks move from being on the street or subways, going to shelter where there's a regular shelter, a low barrier, and actually getting a key. So almost 400 people were able to do that, and that is the goal that we have, the ultimate goal, that people wake up with a key and going to their own beds and their own units. So I mean, that's for us is success for this program too.
Thank you. And Commissioner, I didn't know if you answered, how is the governor's plan going to affect this?
Yeah, sorry. That is, at this point, I don't anticipate that it will affect it, but it's something that we're looking at very closely. We are still out at the end-of-line subway stations. We're still doing all of the work that we're doing.
She was on record saying that if you don't want to ride the train, don't want to get your bags checked, you shouldn't ride the train. So I'm assuming this is going to affect the outreach that you guys are going to have.
I mean, first of all, most of the outreach, for what it's worth, happens in the stations rather than literally on the trains. I think this is a place where we're going to have to wait and see and engage with our colleagues at the state level before I can say anything definitively. The plans were identified or developed separately from one another, so we're going to have to make sure that there are no adverse impacts.
All right. Thank you. Thank you, Chair.
Thank you. Councilmember Schuman is next, but before she gets on, I just wanted to piggyback on the ID NYC issue. So in the Bronx, we have just one ID NYC site. In Manhattan, we have 3 because we have more people applying. It's become increasingly difficult to even get an appointment. Could you explain why the Bronx has just the one site, and is there any intention to increase the amount of sites to accommodate the influx of the demand in all boroughs?
Yes, happy to speak to that. So one of the Bronx sites that we did have, we ran into space challenges that made that site not something we could continue with. So currently we do only have one site. We are consistently looking for ways both that we can look to expand the capacity at that site, as well as looking at other potential opportunities that may come to us in regards to being able to open another site in the Bronx. We're also very happy to connect and work with council members like we have done before, as well to do some pop-ups if that would also be helpful on some needs. But I understand and see the need in the Bronx of one site is not comparable to the other boroughs.
So I mean, I get that you would want to do things, but what have you done since the other site closed to ensure that you're identifying another location, or to collaborate with council members and maybe using their offices when possible? What action have you guys taken?
I mean, we first started by looking at ways in which we could expand the capacity at the one existing site that we do have in the Bronx. We are looking at the moment to see if there are other opportunities for space. We have not identified one yet that would meet the needs that we would, require from both a waiting area and other aspects. We're happy to reach out to the council members, in the Bronx. But we've also been connecting with our colleagues at Moya to identify other community members, community partnerships in the Bronx that we might be able to work with. At this point, the needs have been taken over by the other sites. I understand that's not right in the Bronx. It is something that we are continuing to work on as we, have sort of stabilized at least the appointment system in online, so that we can look at ways in which we can make sure that our footprint covers all of New York City.
I would hope so, because if I see that the demand is growing, that tells me that we need more of whatever it is that we're supplying. But I also would have loved to have heard from you, as opposed to me having to bring it up at a committee hearing. I think that is a reflection of, it shows good faith efforts on behalf of the agency with the borough and the impacted individuals that may be looking for these resources. I never received any. I didn't even know that there was only one until a reporter called me and I was made aware that that there was just one, and I thought, has anybody looked at the map of the Bronx? Like, it's, the Bronx is a pretty decent-sized borough, and traveling to and from 249th Street is not as easy as you would think. So I'm really disappointed that to date, there's only that one site. I think it's a disservice to the borough, and I know that it's a resource that we desperately need, but I not only want to advocate for more in the Bronx, but citywide. I'm seeing longer wait times for an appointment, so that means that the demand is higher. Maybe working, I don't know, I would imagine that we're working with Moya and making that resource available at HERCs and asylum-seeking shelters. Maybe, you can do pop-ups there as well, because it seems like a lot of the demand, is driven by that population as well. But obviously, we need more sites.
So, Councilmember, I do apologize for communication breakdowns. We will certainly work on that going forward. We are doing pop-ups with the HERCs and the asylum sites to make sure that we are bringing meeting people where they are in that respect, and happy to collaborate with you offline on potential replacement site in the Bronx.
Appreciate it. Thank you, Councilmember Schuman.
Thank you, Chair. I wanted to go back to the little bit of line of questioning of, good afternoon, Commissioner, sorry, of my colleague, Councilmember Riley. So for the employment services contract with HASA, who is the contracted provider right now?
The Gay Men's Health Crisis, GMHC.
And what type of clients does the contract serve?
HASA clients.
Okay. So how is the determination made to include this PEG in the preliminary plan, and how is the PEG amount calculated?
As the Commissioner said, very difficult choices had to be made given 90% of our budget is committed to entitlements. So there were no easy choices for us. But looking at our overall employment services and the other offerings we have borough-based, this contract was one of the ones that we unfortunately had to put up for the PEG. The contract's value is approximately $280,000.
So you're taking this internally, correct?
Yes.
So GMHC, which I worked for in a previous life, serves a client population with a long history of mistrust in government and healthcare-related service delivery. They've built a relationship and reputation with these communities for over 42 years, which is critical to their ability to successfully manage the RISE contract. So how will HRA cultivate the same trust and relationship with HASA clients to ensure similarly successful outcomes?
Our workers will work closely with GMHC before the contract itself ends to make them aware of the other offerings that we can have and that we can connect them to. We'll provide, communications to them and explain to them in detail what other services are available that can be comparable to what they receive at GMHC. But it will definitely be a shift, but it is something that we will do closely with GMHC and through our HASA caseworkers and other outreach workers who have connections to our HASA clients as well.
And I presume from your response that you're not going to ask for restoration of the PEG in the executive plan.
We're working really closely with OMB on our budget overall, but I really just do want to reiterate what Administrator French said. This was not a cut that we wanted to
No, understood.
Right.
Just
We were faced with a tremendously difficult set of circumstances and a very limited pool of discretionary tax levy.
All right, and I just wanted to just quickly ask a follow-up question again to what Councilmember Riley mentioned about the subway safety program. My understanding is that from folks I've spoken to and that are working in the program and everything else, that there's a need for nurses, because what happens is when the police bring somebody to a hospital, they're discharged right away, but if a nurse makes the recommendation that they go to a hospital, they get treatment and they stay for a while. So I wanted to ask you about that.
Administrator Carter, you want to talk about our RFP for nurses?
Oh, sure. Thank you, Councilmember. We actually do now have a small cadre of nurses that's with our outreach teams, and we are putting out in an RFP to actually bring more nurses to the teams, because we do agree that we certainly need nurses to be in those outreach teams, because we know that if the nurses are with when they get to the hospital, that there's a different connection that's made. So we are certainly working on that, and we are walking lockstep with you on that. Absolutely,
Okay.
yes.
Thank you very much.
Thank you, Councilmember Schulman. We will now hear from Councilmember Ressler, followed by Brewer.
Great. I didn't know I was coming up, but I'm ready. Commissioner, it's always good to see you. I know I sometimes give you a hard time at these hearings, but I will say on the record, I have a lot of respect for you and appreciate the hard work of you and your team. It's not an easy job. So there are a couple items I'd really like to dig in on today. Firstly is placements in NYCHA, which, as you know, has been something I've been very concerned about in the trajectories and the changes that we've seen in this administration. So year over year, we're looking at a 30%, based on the PMMR stats, we're on pace for a 30% reduction in the number of people placed in NYCHA or in Section 8 relative to last year. As homelessness increases, that's a major concerning trend. I'm even more concerned about the placement in NYCHA specifically. When the mayor came into office, we had placed 1,597, 1,600 households in NYCHA apartments in 2021. This year, we're on pace for 480 based on the PMMR. So a 2/3 reduction in the number of homeless people that are getting placed into NYCHA. This is the housing stock that we control, our best solution for moving homeless families out into housing. What is HRA and DSS and DHS doing to reverse this terrible trend? There are 5,000 vacant NYCHA apartments, 10 times as many as when the mayor arrived. What are you all doing to fix this?
Thank you, Councilmember. That's not a question that I can answer solo, right? Because it certainly involves NYCHA as well. What I can say is that we are steadily increasing the pace of our permanent housing placements with a particular focus on our subsidized housing placements. So last year we saw a 17% increase in housing placements overall. This year we are on track based on the PMMR data to exceed that.
I appreciate you made some progress in other places. I'm on the clock though, but is there anything you can say, because you feel the urgency more than anybody in city government. You were on the hook on this census, which has exploded, not partly as a result of migrants, partly not. The census has exploded. You feel it every day. You want to drive that number down. 5,000 vacant NYCHA apartments, 2/3 reduction in NYCHA placements of homeless families since the mayor came into office, happening each year. What are we doing about it?
So I don't want to speak for NYCHA, but I really respect the work that they are doing to ensure the long-term stabilization of that housing stock, right? If we lose NYCHA, we are all in a much worse off place. As I think we all know it is housing with very serious physical issues, but you can't do large-scale physical rehab with a 100% occupied portfolio. You have to be able to checkerboard. You have to be able to do internal relocation. We are absolutely taking advantage of every NYCHA unit that is available to us, and I'm going to have to defer more details to them.
I have to say, Chair, would it be okay, Madam Deputy Speaker, could I do one more item? I appreciate this is NYCHA's job to fix up the housing, but if you're not advocating with all of your potential power and pressure on City Hall to fix this, it's not going to get fixed. I don't have faith. We've seen no progress from NYCHA in a year and a half of us screaming from the rooftops. They've tried to cut funding from the budget time and again for NYCHA repairs. So I just am asking that we try to work together to push this administration to get their house in order so that we don't see the number of vacant apartments continue to increase, the number of homeless people who are stuck in the shelter system because we are no longer placing people in NYCHA in any meaningful way is a major problem.
I am a fierce advocate for housing placements for our clients. I'm always happy to collaborate, but
Thank you.
I rest assured I am working every angle.
Okay, it's just every data point we see is things getting worse, not better. Last item I just want to ask is the FY25 budgeted headcount is 11,998, decrease of 136 positions, and a decrease of 1,659 positions since FY21. We're talking about 14% decrease in HRA headcount just since the mayor came into office. Despite 1 in 4 New Yorkers living in poverty and you all having highest cash assistance and food stamps rolls that you've had in decades. So do you think you can actually manage the agency effectively with this headcount. And I just will note that when Administrator Fitzpatrick, who I have a lot of respect for, testified, and congratulations, Administrator French, testified before this committee last year, she said that in her 40-year history at HRA, the headcount in the agency had never been that low. Do you believe that you can meet the needs of New Yorkers with poverty growing as significantly as it is, with this massive reduction in headcount that the mayor has imposed, that OMB has imposed on you since he came into office?
Thank you, Councilmember. So with respect to the change between FY24 and FY25, that is a piece that is still under negotiation and conversation. I don't think those numbers are finalized yet.
But it is the proposed, I mean, it is the headcount in the preliminary budget that the mayor released.
And emphasis on preliminary.
Totally, and we'll fight to restore it.
We are still under negotiation. With respect to the larger trends, there's, yes, headcount is down over a long period of time, but there's also been significant shifts in the way that benefits are administered, right? So at this point, more than 90% of cash and SNAP applications, or about 90% of cash and SNAP applications, are received online, right? It's a very different process than it looked like, even 10 years ago. So, absolutely, the people who do the work are the lifeblood of the agency. We need to keep monitoring that. We need to keep hiring to fill up our vacancies, and that's something that this team can tell you I've been very laser focused on, and you see that in the growth in our headcount.
So what are the number of vacancies at HRA today?
We have about a 9% vacancy rate. It's about 1,100 people, which, it's higher than I would like it to be, but it is close to half of what it was a year ago. Right. So we've been really making a lot of progress. So we're focused on continuing to fill the vacancies that we have and continuing to make process improvements. If there's needs to change going forward, we certainly will, but the fact that we've been able to virtually eliminate the cash and SNAP backlogs, I think really does show that we can manage with our resources.
And you're confident you'll be able to maintain the provision of cash assistance and food stamps without backlogs growing?
I think we are in a much better place than we are. Certainly, we're going to have to keep monitoring application trends and things like that. We will make adjustments as needed, but yes, I feel much better about where we are now.
Okay. I hope that we'll be able to fight to restore your headcount together. Thank you.
Thank you. Councilmember Brewer?
Thank you very much. First, I want to give a shout out to Gregory Edwards, who's in the Home Visit Unit, Center number 90, because he came one Friday night back and forth to Brooklyn to get a client in our office, 8 o'clock at night, the SNAP card. So I just want to be sure that he gets the credit that he deserves.
Thank you very much, Councilmember.
Cliff, you mentioned earlier when you were talking in your speech, opening remarks, I was in the National League of Cities this weekend, and there were several people there from the federal agency, and I think you're doing better than they are. They were worried around the country because obviously you give people benefits, they don't want to take them because they're worried about losing other opportunities. How are you dealing with that? Is that an issue in New York? You mentioned it earlier.
The income disregard?
Yes, so I call it the cliff problem, but yes.
So New York State last year passed legislation that gave us what we call our earned income disregard. So it allows us to continue to provide cash assistance benefits when people are in subsidized training and subsidized employment programs, and does a one-time 6-month earned income disregard for people who have gotten non-subsidized employment. There's a lot of nuance behind that, which we can certainly get into offline because it does get very complicated. But the short answer is it means that it smooths out some of that cliff.
But I think it's still an issue because I hear a lot from NYCHA residents who do not want to get X, Y, and Z because they're nervous about losing. They don't understand that their rent's still going to stay 30%. But maybe an offline discussion because I think it's not solved, the problem.
It is, I think it has helped. I would agree that it has not solved.
And the feds are looking to have some more support, just FYI.
Happy to have an offline conversation.
Okay, number 2, the feds also stated that on Friday they were meeting with you or OMB, and the problem of figuring out what is still owed in terms of the migrant situation. I don't know if this is you or just Health and Hospitals. They think they've solved it. Remember, this was a big OMB discussion with the director. Has that been solved?
I can assure you it was not me they were meeting with on Friday, so I will talk to colleagues and we'll circle back.
Okay. The issue of direct poverty money. Now, CSS just put out a report, I'm sure you saw it, 1.5 million adults, 420,000 kids in New York City are in poverty. Big numbers, bigger than in the past. So are we thinking about doing what other cities are doing, which is direct dollars to those who are in a poverty situation?
So there are a number of ongoing pilot programs, pilot initiatives around direct cash transfer programs. Some of them show some somewhat promising results. Some of them it's too early to tell. It's something that I'm always happy to look at. There's all kinds of really complicated interaction with federal benefits, both on a client level, making sure that we don't run into a cliff issue, but also making sure that we aren't losing out opportunity to claim federal dollars and replacing federal spending with city funding, which creates challenges as well.
Okay, so I'd like to hear more about that offline. Main Chance, 3.5 million cut. I support Main Chance strongly. They are going to be applying for Safe Haven, which might address some of the concerns you have, just like the chair feels strongly about the Bronx programs for workforce. I feel the same way about Main Chance. What can we do to restore the 3.5 million, or would you be amenable to the Safe Haven proposal?
So thank you, Councilmember.
You know that I care about this. Thank you.
As you've discussed with me and with Administrator Carter, we're happy to look at a safe haven proposal. It will need to go through the competitive RFP process, but we're more than happy to take a look at that. Our shift has generally been at this point towards looking at drop-in centers that are coupled with beds. We feel like
they'll have beds.
Continuum of care model works better for clients.
Okay, and just finally, vacant units in supportive housing. How many of them are vacant in supportive housing or in places that I don't want to mention because I know where some of them are, but people want single rooms. And so congregate housing, how many beds do you keep track of that? Because some congregate housing nonprofits have a lot of vacancies.
Thank you, Councilmember. I think I'm following your question, and between Administrator French and I, we will do our best. So the overall vacancy number for supportive housing for the units that we track through our CAP system, it's a fluid number, but it's about 1,900 units.
That are vacant today.
Yes, a lot of those are in process. They don't physically have somebody in them, but the person has been matched. It's in process. There are units that are just coming online. There's a variety of different stories there. In that number are some SRO, a non-trivial number of SRO units. These do tend to be units that are a little bit harder to lease up. We recognize that that they are less appealing to clients. We're working with the providers who operate them. One of the things that I think is a challenge is that with rental subsidies, you're generally expected to pay 30% of your income in rent. And certainly if I could pay 30% of my income in rent for an SRO or for a studio, I would hold out for the studio. Within City FEPS, which is a program that we control, we have changed that so that there's now, if you're renting an SRO unit, it's a flat $50 rather than the 30% of income. But many of the SRO units have rental subsidies that we don't control, so we're looking if there's other ways that we can address that.
Okay. Thank you very much. I have more, but maybe second round.
Thank you. We will now hear from Councilmember Banks, followed by Councilmember Rivera, followed by Stevens, and then Hudson.
Thank you, Chair. I just had a couple of questions, particularly about the scamming of the EBT cards. And I wanted to know, specifically, I know earlier one of my colleagues had asked about it. When a client or a participant reports or it's known that the EBT card has been compromised, the time frame after the investigation is being done, why does it take so long for them to start getting back their benefits or their particularly the EBT card access?
Thank you, Councilmember. So until fairly recently, we're not legally allowed to replace benefits at all. So when people reported skimming it was replace your card, and that is the only option. There was a change in state law that allowed us to replace benefits that were stolen. I think we've actually been processing claims quite quickly. One of my colleagues may have the time frame on that, but there
Yeah, if
are
we can get the time frame,
Yeah.
that's what I'm more concerned about.
Okay. There are certainly many people who, if they experienced skimming, a year ago, they were not able to immediately apply for replacement benefits because, frankly, the replacement didn't exist. We're very glad that it now does, although, as I mentioned, I think the longer-term solution is chipping the cards.
So on timeframes, typically within 3 days of determination,
2 days,
the
okay.
benefits are loaded on the card, and we rarely have any applications that are more than 10 days old. If you have constituents with longer timeframes,
Thank
just
you.
let us know.
Seems there's been some cases where, when it comes to the FEPS voucher, it seems there's been cases where the amounts that should be corresponding with the agreed upon rents that's approved by the voucher are being honored by the amount that's not being honored. It's actually not being honored by the landlord. And I wanted to know what is being done to fix that situation, because folks are being dragged into court or being taken into court for the remainder balance.
So it is absolutely a violation of regulation to do any side agreements. That is prohibited by landlords. So I would appreciate it if you could send us cases on that offline.
Thank you.
Councilmember Rivera?
Thank you very much, Madam Chair. I just want to ask a follow-up to Main Chance, which is in my district. On average, do you know how many clients does this site currently serve a day? How was the decision made to close this center? What metrics were utilized? You mentioned that they don't have beds. Was that ultimately what prompted you? And where is the next closest drop-in center located? Does it have adequate funding and capacity to serve additional clients?
Thank you, Councilmember. I'm going to start, and I will pass it over to Administrator Carter. So, yes, the basic premise is that we've been trying to move our drop-in center model slowly, but towards a system where we're coupling drop-in centers with stabilization or safe haven beds, so that we're really providing a true continuum of care for clients. But Administrator Carter, can you speak to the additional details?
Thank you, and thank you, Council Member. I'll get back to you in terms of the number of clients. But one of the things that our Street Solutions division has been looking at is how do we administer services to the unsheltered. And so I talked about how do we help earlier in the subway safety plan, the throughput. And so we do want to make connections and make that unit, that division, to be able to have a connection from chairs to bed to exits. And so we're moving that division to have that real collaborative setup where you can come into a chair, make that connection to a staff, to be able to get to a bed and to move to permanency. So that's how we're trying to realign our Street Solutions area. So that is why we made that decision for the Main Chance. One of the things that we're also doing is really making sure that those who use Main Chance, that they know where the other ones are. Manhattan is the only borough that had 3 drop-in centers. The other outer boroughs only had 1. So there are 2 that's in Manhattan. There's 1 in West 14 and there's 1 in West 30. So we're making sure that they're aware of where those are, and we're going to be putting up signs, and they're beginning to talk to the clients as they come in of where they're going to be, and we'll make sure we share that information.
Thank you. Before you do all that, I want to make sure that we're working with the people at Main Chance, because our goal here, as you heard from my colleague, Councilmember Brewer, is very invested in this site, is to keep it open and operating. They're critical to that area and to the work that you do. So I just want to ask very quickly with my time. I see the Archdiocese is here. I want to thank them for making available St. Bridget's and the work that we're doing there. Do you know the cost to operate the St. Bridget's reticketing facility in the East Village? Yes or no?
No, I'm sorry.
All right. Have you done an analysis of external or duplicative costs to continually reprocessing people through your systems, such as transportation, food waste, administrative costs?
Councilmember, we as a city, and at this point I'm speaking as an administration official, not specifically for DSS, but have really been struggling to meet the needs of the asylum seekers. The time limits are a challenging policy option, and I certainly acknowledge that, but we are in an emergency situation that really merits emergency solutions. We need to make sure that we are focused on moving people through. You know, none of these individuals came to the United States for shelter. They came for work, for opportunity. So making sure that we are focused on that. And that we're also making space for the next round of people, because although it is not quite as bad as has been, the buses haven't stopped. We continue to get people every day. So recognize the challenges that come with the 30-day time limit, but also really need to acknowledge that we are in an emergency situation. Because this isn't in the DSS budget, I can't speak to the specific dollar amounts.
No, and I know that because of the OEM and H&H, but I did ask you this question just a few days ago, in fact, so I was hoping, I'm disappointed you didn't bring that number. You don't have that number with you, since I had asked about St. Bridget's. And all I'll just say is that my questions are really rooted in looking at the efficiencies to your processes, operating the wait lists, the costs associated with mobile outreach, like for those that are sleeping on the street or in the subways, and how have those analyses been going? I mean, we want to make sure that the cost of street outreach and shelter stays is clear, right? We want to house folks. We don't want them sleeping on the street.
I couldn't agree more. Permanent housing is the end goal for everybody. We're really focused on that within the agency. It's why we saw the 17% increase last year that we're on track to exceed this year.
Okay, well, thank you very much, Madam Chair, for the time.
Thank you. Just to follow up to Councilmember Rivera's question. So, obviously we agree that we're in a dire situation here. And one of the tools that we do have at the table to try to expedite the move outs of folks, independent of the 30 and 60-day rule, which I obviously do not agree with, is getting them to work. So would you be able to tell us who's responsible for applying for working papers from the federal government for the asylum seekers?
So I think I understand the question, but bear with me if I need to clarify. Obviously, it's an application to the feds for work authorization, either as standalone for somebody who's applied for asylum or in conjunction with a TPS application. The city has stood up extensive clinics to help people do those applications. So that has been run out of City Hall, out of the Mayor's Office for Asylum Seeker Operations. And I think tens of thousands of people have been able to submit applications. The actual work authorization documentation goes to the individual themselves, not to the city. So we don't have specific numbers on the number of people who have received work authorization, but my understanding anecdotally is that the success rate is very high.
But do you know how many applications have been filed?
It's something along the order of 25 or 30,000, but I'll get back to you with the specific number.
Okay. And would you know how many employees or contractors are working on this?
I'm sorry, I don't, since it's not directly under my purview.
All right, thank you. Councilmember Stevens, followed by Hudson.
Hello, good afternoon. I'm over here. I just have a couple of questions, and they're various topics. So the first question I have is, does the agency have any delays in processing child care applications? And what is the average processing time for a child care application?
So that is largely not processed at DSS. I think it is, and Administrator French, please jump in here, but we are part of the child care equation in that people who are on public assistance can qualify also for child care assistance, but it's not administered through the agency.
Okay. So I know Deputy Speaker already started to ask questions about the IDC, the IDs in New York across the city. What's the website often timeout or will not populate appointments? Is there an issue with the administrative needs to further invest in the technology?
I have not heard of systemic issues with the website, but if there are specifics that you have, let me know. But we are releasing 6,800 appointments weekly, and most of those are then scheduled through the website. But I'm happy also to talk to individuals on my side to see if there's anything, but I haven't heard of any systemic challenges with the website. But that doesn't mean people.
Yeah, I will say you might not have heard of systemic challenges, but we are hearing challenges back in our office around getting them. So I don't, so it might not be a technology thing, which is why I'm asking, is there looking for advancements to expand in some of the technology? Because we have been hearing in my office and in a couple of other members' offices where they've been experiencing delays or not being able to get an appointment. So just thinking maybe how do we make sure we expand in technology? Because that is something we often lack at the city, where we're having programs that's already outdated when we get them.
No, we are definitely always looking at ways in which we can enhance our technology. So this is something that we'll definitely take back and talk to the team about, and happy to follow up with you or others as well on the specific issues folks might be experiencing, so we can see if there's any, if we experience them on testing on our side as well.
Okay. And just another question follow with this. Because there has been a rise and an increase in use of the IDs. Is there anything fiscally prohibiting the administration from creating a direct ID NYC hotline in addition to the current 311 questions redirect? And what does the staffing look like for this?
Certainly, there would be a cost implication for doing a direct hotline. I think it's not something that we've actively looked at, which we certainly are happy to have a conversation with you about that. And I think one of the advantages of 311 is that it is a single place to go, right? So nobody has to know this is the number you call for ID NYC inquiries as opposed to everything else. So happy to have a conversation about what you're envisioning, but I do want to make sure that we're leveraging the 311 infrastructure.
Absolutely. I'm an advocate to make sure that people are using 311 because understanding that it helps us collect data, but I think just also thinking about even within that infrastructure, how do we kind of like use that more as a resource? And then my last question is, over the weekend we did hear about some employees who were, process for, stealing some identities of folks who were in the shelter. What are you guys doing to prevent this from happening again? And what are some of the steps that you're implementing now after this has broken?
Yeah, let me start by saying I'm horrified by this situation, and these 4 individuals do not represent the 12,000 employees who work hard on behalf of low-income New Yorkers every day. So, and I'm very grateful for the district attorney for the thorough investigation that they did. So we do take our clients' privacy very seriously. We have a number of mechanisms, and fraud prevention. We have a number of mechanisms in place where we do a series of fraud detection mechanisms, looking at people's benefits, looking to see if there's any pattern, using data to see if there's any patterns of inappropriate benefit use. We have privacy guidelines and have been enhancing those in conjunction with OTI to make sure that we are putting all the protections in place to make sure that systems can't be hacked, that only eligible people have access to data. I would say clearly from this, that indicates that we have work to do, so we will be following up with the Department of Investigation and the District Attorney's Office to make any changes in process that seem appropriate.
Yeah, no, thank you. And I say all that to just say, because, obviously there's a number of things that's going on in the city in these last couple of months with fraudulent and people losing the trust in the systems that we put in place. And just thinking about, with all of those things, this is still able to happen. And so thinking about what are some new innovative things that we can do, and even on the conversation around technology, how are we using those to kind of help and support some of this work? So definitely would love to continue to have conversations about what we're doing to make sure we're securing and keeping everyone's information as safe as possible as we're moving forward.
I appreciate that. Thank you.
Thank you. Councilmember Hudson.
Thank you so much, Chair, and hello, how are you all? The preliminary plan includes city fund savings of $1 million in fiscal 2024 and $3 million in fiscal 2025 from the NYC Benefits Program, which contracts with community-based nonprofit organizations across the city to provide assistance with public benefits, eligibility screening, and applications. Funding for this program was first added at fiscal 2023 adoption as a joint priority between the administration and the council, and it's a vital resource aiming to increase public benefits enrollment amongst low-income city residents. How will the savings be generated, and is HRA advocating for this cut to be restored in the executive plan?
Thank you, Councilmember. We are big cheerleaders for this initiative. We think it is really important that we continue to fund CBOs to do this outreach and engagement work. When the program was originally stood up, in order to be able to move quickly, there was a third-party intermediary, so we don't actually, right now, we don't directly hold the contracts with the CBOs. We are able to now take those over so that we're losing a layer of administrative costs in between, but the CBOs, we are going to continue to work with the CBOs.
Are you referring to CUNY?
Yeah.
As the third party? So you're saying that they will or will not continue to administer the program?
CUNY will no longer administer the program.
Okay, so how will the operations and administration of the program change when they're no longer involved?
DSS staff will directly administer the contracts, but we will continue to work with the not-for-profits. They will continue to do the work that they've been doing.
Do you know how many CBOs are part of the program?
I think it's approximately 36, plus another several doing technical assistance. So, yeah.
Okay, and then do you know the breakdown by borough?
Not off the top of my head, but happy to circle back with you.
Okay. And can you confirm that there will be no programmatic impact to any of the CBOs in the program?
So there's no programmatic impact from the PEG. As you may see, the baseline funding for the program, it does change year over year. We are currently in negotiations with OMB to ensure that we hit the right level of CBO funding.
Okay. We've heard from CBO providers that despite being granted a 3-year award, their initial contracts were for just 1 year. Do you know the cause of that?
So the program is originally structured, was set up on a calendar year basis. We really need to be doing our contracts on a fiscal year basis, so we're in the process of realigning now.
Okay. And we've additionally heard from providers when their first-year contracts ended in December 2023, they were not automatically given another contract. After some delay, while many of them continued to provide services without a contract in place, they were granted a 6-month contract. Do you know why there was a delay and why the contract term was shortened? I assume, again, it's based on fiscal year.
Yeah, we're realigning to a fiscal year. We also ran into some process hiccups because that was at the point in time at which OTPS contracts were all under additional levels of OMB review, but we are moving full steam ahead now.
Okay, great. Thank you so much.
Thank you. I wanted to ask a question regarding the New York City Benefits Program. I saw that it's not funded beyond June 30th of this year, fiscal year 24, but it was intended to be a multi-year program. Where are we in terms of conversations ensuring that it's funded for future years?
So there is funding in FY25. It is less than there was in FY24, and then we're in conversations with OMB about that.
Okay. How much less?
FY24 was funded at 9.2 million, FY25 at 7.2 million. So we're in the process of resolving funding levels with OMB.
Okay, all right. And I have a question regarding the burial assistance for undocumented individuals. HRA's Office of Burial Services provides financial assistance with funeral expenses for eligible low-income city residents. During the pandemic, there was funding available to undocumented individuals who do not qualify for this program. Does HRA still provide burial assistance to undocumented individuals?
Regarding that program, we look at things on a case-by-case basis, and in certain instances, there will be exceptions where we will pay for it, but I don't know if Chief Levine has more to add to that.
That was a pandemic era addition to the budget. This is a public assistance funded program, so as Administrator French stated, we will on a case-by-case basis be able to provide funds for undocumented people, but it's not part of the baseline.
But you don't have to be on public assistance to qualify for burial assistance.
You have to meet the income and citizenship requirements to get the benefit, generally.
Okay, and what prevented you from well, what allowed you to make the exception during the pandemic? What, was there a waiver?
It was using a separate pot of money.
It was using
A
a separate
one-time,
fund?
yeah, one-time funding source.
Okay. I asked because we had a situation, I had a situation in my district where we had an asylum seeker that was murdered at one of the HERCs. And we had to, through my office, we worked really hard to try to identify resources to have this individual picked up from the morgue and shipped to Venezuela. It took almost 2 months for us to be able to do that. But we did, so we funded the trip to where we shipped him to. I'm not gonna say because we had to go through a lot of hurdles to get him there, but we got that privately funded. But the funeral expenses for New York were denied through the city and approved through the state. So I don't understand what is the discrepancy. He was a crime victim, and so is it a separate fund?
We're happy to take a look at this particular case.
Yeah, I would appreciate that because I actually spoke to the mayor's office personally, and I still haven't heard back about funding. But initially what I was told was they were looking into it because he was not a citizen, he did not qualify, which I think is ridiculous. I think that whatever rules exist, are antiquated and need to change because we are a city of immigrants, whether you came here from Venezuela the other day or not. I mean, we have a lot of really poor people in New York City, and it's really expensive to have to, view and bury someone. And it's heartbreaking not to be able to do that because you don't have the resources.
Absolutely agree on the heartbreaking piece of it. And it is important that wherever possible, we are leveraging federal resources. And as Chief Levine said, it is a requirement using cash assistance that you meet various immigration statuses. But also want to make sure that we aren't applying that standard too closely or too narrowly. So I will certainly follow up with you on that specific.
And where did the funding come from that you identified during the pandemic?
Those were private funds.
Raised through the mayor's office, or?
I think we're going to need to get back to you on the specific origin. It was private, but we don't have all of the details right with us.
It came from the mayor's fund.
So, yeah, I remember when we passed this bill to open, I think I was the sponsor of the Burial Assistance Office, and really centralizing those resources. On the website, it doesn't say anything about having to be a citizen in order to qualify. It says it's available to low-income descendants that do not have resources or assets available to pay for their funeral. Proof of low-income status may include receipt of social services benefits or public assistance, a legal responsible relative.
Right. So just to clarify, and I think the kicker there is that receipt of social service benefits or eligibility for social service benefits. If you are a citizen and income eligible, that's sort of one standard for being eligible for cash assistance and other benefits. There are other immigration statuses.
But it doesn't say that, Molly. It doesn't say that you have to have. It says that that's a form of proof of low income.
So whether or not you qualify, and we can certainly look at whether or not the wording on the website needs to be clearer, but there's a lot of nuance, and I will freely admit that everything I know about immigration policy I've learned in the last couple of years, but there are various immigration statuses that will allow you to qualify for benefits even if you're not a citizen, right? So somebody who is TPS eligible or who has applied for asylum, they may be eligible for benefits. So it would be inappropriate for us to say citizenship is a requirement, but if this, then that gets very complicated. But we should look at the language and make sure that we're being as clear as possible.
Yeah, I understand that a lot of responsibility is put on, your agents, your respective agencies to assist a substantial number of folks that are in New York City, that call New York City home, that may be in need. But I think that if we're providing these services, then we should be providing them, to the best of our ability and try to remove a lot of the nuances, because it just doesn't seem right to me that through the State Victims Program, somebody would qualify and that question wouldn't even come up of citizenship. But yet, when we're applying for city benefits, it does. And I know that, this was not a DHS site, but I was really offended, because not only did the family never received a letter of, or a call for condolences. Nobody asked about the body. Had the family member that reached out to me from another state not reached out to me, the body would have been buried in Potter's Field. And I don't understand how, on top of that, to add insult to injury, the city says, well, we're not going to pay for it either. He died in a city facility because we don't have adequate security. That doesn't make sense to me. And, I have to say that. And I think that we should really revisit that, because again, this is not even related to the asylum seekers, but we have quite a number of low-income migrants that live in the city, and I just find this draconian to say that they wouldn't qualify because of their citizenship status. So if the state can figure it out, I'm sure that we can as well. She's gone, Gail? Is Gail gone? Okay. Huh? Okay, all right. Are there any other questions from any of the members? No? Okay. All right, well, thank you so much. I know it's been a long morning, but I think we've all learned a lot, and I appreciate your willingness to answer our questions, and hopefully it wasn't too bad.
Not at all. Thank you very much, Councilmember.
Thank you.
Thank you.
All right, we're gonna take a 5-minute reprieve because some of us have to go and freshen up and get something to drink, and we'll be right back.
Folks, please grab a seat. We're going to resume momentarily.
Monsignor, step on up. Yes, give me 1 second.
We will now move on to public testimony. For those wishing to testify in person, please see the Sergeant at Arms in the back of the room and fill out a testimony slip. Even if you have registered online, please still fill out a testimony slip with the Sergeant. All testimony must be on topic. Cursing is a violation of decorum. The hearing is being live streamed and recorded. Witnesses may not use a recording device to film themselves or the proceedings while they are testifying. For those wishing to testify and are on Zoom, after the in-person testimony, we will move on to virtual testimony. Those on Zoom will be called and a prompt to unmute yourself will appear on your computer. All those testifying either in person or virtually are encouraged to submit testimony at council.nyc.gov/testify or via email at testimony@council.nyc.gov. Thank you.
I just want to add that we have a lot of folks that are registered to testify, so we may be very quiet on this end. We want to just make sure that we have all the information, so if you guys could just try to keep it to the 2 minutes, we would really appreciate it. Thank you.
Please turn your microphone on. Thank you.
Thank you so much for the opportunity. I do have written testimony, but in the interest of keeping it brief, I'm just going to talk about 3 things: food, shelter, and how we make sure that New Yorkers have those. So food, let me begin with food. I was up in your district a few weeks ago on Ash Wednesday and saw the line all the way from the middle of St. Cecilia's to Park Avenue. And we were able that day to do a little bit extra. We had fresh produce, and people were delighted with that. But it's hard to do that because the numbers are greater, they have less money, and food costs a lot more. So one of the things, hopefully, you will consider as you do the budget this year is maybe some of those programs that we used during the pandemic, where there was an additional amount of money that could go to small pantries. Not huge, but maybe 15, 20 million, that could go out to those small pantries, which we have about 30 of them, and I know other groups did. So food is critical, and we need a little bit of an extra boost this year in terms of food. Secondly, I know the council has been very good in some of the housing rental assistance programs. I understand some of it is in court, et cetera, but that's critically important too. Whatever can be done to keep New Yorkers housed is critically, critically important. And then the final thing which I want to talk about is kind of the work issue in terms of who is actually helping people to stay in their apartments, who is actually delivering the food. And a lot of it is nonprofit organizations like Catholic Charities, like Main Chance, and I'd like to call special attention to a bill of which you are one of the sponsors, but Councilmember Hudson is the lead sponsor, Intro 243, which basically says that nonprofit organizations should be paid for what it costs them to deliver the services and to fairly get an indirect rate with regard to that, because that's what enables people to get help when they're facing eviction. That's what enables them to get the food they need. So those are the three things that I want to raise up. In my written testimony, there is a lot more. And personally, since I'm in a church on Park Avenue and 34th Street, I can really speak to the value of main chance. Because whenever somebody comes to our door, we can say, hey, just go down the block, they'll help you. And so, again, I thank you. Food, shelter, supporting the organizations that provide that is critically important. Thank you. I hope I didn't take too much of your time.
We wouldn't stop you anyway.
Okay. Thank you so much.
Thank you so much, Monsignor.
Okay, the next panel will be Gladys Little, Luci Perez, Thais Grant, Jake Greenberg, Allison Robinson, and Corinthia Carter.
Okay, you may begin. Whichever end wants to start first.
Is this on? Good afternoon. My name is Jake Greenberg. I'm a case manager with the Center for Urban Community Services, where I provide services to people living in supportive housing. This involves connecting tenants to everything from food stamps to Social Security to medical and psych care, in addition to building relationships with people often facing severe isolation. Across CUCS, my coworkers show up every day for people who are currently homeless and those living in supportive housing still dealing with extreme poverty. We are here as DC 37 members and are currently in the process of negotiating our first union contract. We are city contractor workers facing chronic low wages. Our work is hard and often overwhelming, and I can say that every case manager and social worker I've worked with is here because they care. Across our 20+ programs, we lose caring workers all the time because of our low wages. Our clients feel the brunt of this turnover. Our work is only as valuable as the connections we form with the people we serve, and these relationships are severed every time we lose another worker due to low pay. Our jobs are designed to be a part of the solution to homelessness in New York City. Homelessness is created by poverty. There can be no progress made towards reducing homelessness in the city if the thousands of workers across dozens of contracted agencies are left vulnerable to the same housing insecurity that our clients are trying to escape. We need higher wages to do the work that we love and the city needs us to do. We are committed to our work and united in the fight for fair compensation and dignity in our city contracts. We ask for an increase to the DSS budget to keep the city's homeless services running. Thanks for your time.
Good afternoon, Chair Ayala and members of the committee. I am grateful for the opportunity to testify today. I am Gladys Little, an eligibility specialist and a member of AFME Local 1549, District Council 37 in New York. I've worked in SNAP for 12 years. Unlike my colleagues who presented today, I did not testify in September. However, I can report the challenges that have been described are real. They have persisted in my work since long before the September hearing. Mandatory overtime is still happening. On my daily schedule for work Monday through Friday, I start overtime at 7 a.m. until 8:30 a.m. when the telephone calls begin coming in. I face constant Angie system glitches daily. I'm required to enter each Angie problem in the system, which issues IT tickets and cases throughout the day. This inflicts significant harm on our clients who do not receive benefits in a timely manner. In fact, clients who do not receive benefits when their applications and recertification cases are in process suffer the closure of their cases. As a result, they are reapplying every day while the IT tickets on their former cases lie unprocessed. During my interviews with these clients, their frustrations overwhelm the interview. I can hardly ask the pertinent questions, so the interview takes longer. I have not seen any drastic resolution with the Angie system issues, a resolution which would eliminate repeated errors and erroneous cases processed repeatedly. Daily, while I'm working on a case, I have to suspend the same case several times in order to properly process it. I also have co-workers forwarding their IT ticket lists to supervisors daily in an attempt to get the IT issue resolved. Despite these frustrations, I am always assuring clients that they will receive the food assistance they desperately need. I tell them I remain hopeful. I have seen very little a change in HRA, assisting the adequate improvements that are necessary. Also, I also have seen, according to my Angie system, as of Friday, March 8th, there are still 21,000 case backlog. These statistics change daily. My hope is that HRA will properly address and fix the Angie system soon so I can do my job to ensure accurate, timely benefit delivery to the most vulnerable New Yorkers.
Thank you. You can email if you have a longer testimony. You can email it to us. We're just trying to really keep to the 2 minutes because there's a lot of folks behind you that have to testify as well. But I appreciate your time.
Thank you.
Please make sure that your mic is on. Yes.
Good afternoon, Chair Ayala and members of the committee. I am grateful for the opportunity to testify today. My name is Thais Grant, and I am a SNAP eligibility specialist and a member of ASME Local 1549, District Council 37. I have worked in SNAP for 11 years, and I testified before this committee in September of 2023 about the daily challenges I confront in my work. I can report to you that nothing in my work has changed since we last spoke, because there is still a huge SNAP backlog, over 18,000 cases as of last Thursday. This far exceeds the backlog of 411 cases reported by the city last week. The program, Angie's case processing system, is still a significant barrier in my work, and it contributes to the persistent backlog in SNAP. As I stated in September, this flawed case system was intended to decrease the workload. However, I have found that it instead increases my workload and contributes to the backlog of SNAP cases. So basically, Angie was designed so that supervisors from any SNAP center can approve your case. However, this is ineffective because supervisors can sign off a case which causes errors, and you don't know who's signing off your cases, and you don't get that case back. Another worker gets the case, and this delays timely benefit delivery for our clients who need life-saving food assistance. Basically, just working in Angie, it has significantly decreased the processing of cases. Myself and co-workers have reported that we used to process up to 10 cases per day, but now due to the frequently glitches in Angie, we can only process 7 cases. This all results to this system glitches in Angie, and we put in IT tickets, but there is still no resolution. I do have a lot more, but due to time, I just want to mention that at my site, we are not we're not mandated overtime. However, we do have voluntary overtime, which has been extended from the hours to 10 p.m. on weekdays and to 9 p.m. on Saturdays. And I just want to conclude that if there has been, the city has stated that they hired new staff. If they have hired new staff, then why is overtime still in high demand? And we're not benefiting from the overtime with the Angie system. Thank you.
Appreciate it.
Hi, my name is Allison Robinson. I'm a case manager at Center for Urban Community Services. I'm here today not just as the case manager for supportive housing, but as a voice for countless individuals and families who depend on our services for stability, dignity, and hope. Our mission is not just to provide shelter, but to empower those in need to reclaim their lives and thrive in their communities. Yet in our pursuit of this noble goal, we face an ongoing struggle, a struggle that hinges on the availability of resources. HRA and DSS agencies are entrusted with providing crucial support to most vulnerable members of our society. It stands at a crossroads. It's a crossroads where decisions impact lives, where every budget allocation echoes in the daily realities of those we serve. Today, I urge us all to recognize the vital importance of increasing resources for HRA and DSS. Supportive housing is not merely about putting a roof over someone's head. It's about addressing the challenges that accompany homelessness, mental illness, addiction, and poverty. It's about providing wraparound services that enable individuals to regain their footing and become active participants in their communities once more. But to achieve this, we need adequate funding. Increasing resources for HRA and DSS is not just about numbers on a balance sheet. It's about investing in human potential, in the worth of every individual. It's about recognizing that when we lift the most marginalized among us, we create a ripple effect of positive change that benefits society as a whole. By bolstering the resources to HRA and DSS, we can expand access to supportive housing, ensuring that no one falls through the cracks. We can enhance mental health services, substance abuse treatment, and job training programs, providing pathways to stability and self-sufficiency. We can invest in preventative measures, tackling the root causes of homelessness and poverty before they spiral out of control.
Good afternoon. Thank you, Chairperson Ayala and members of the committee. My name is Corinthia A. Carter. I am a worker and the president of LSSA 2320, which represents 110 unionized workers of Mobilization for Justice that are currently on strike. I was just in the Bronx. We were striking in front of Bronx Housing Court this morning. And we also represent over 500 workers at Legal Services NYC that are currently preparing to enter into their contract negotiations very soon. My testimony today doesn't include metrics, though I will highlight the important stuff. As you know, across the city, because New York is a union town, there are many workers on strike, including New School, and we support them in their demand for working conditions, which we, MFJ members want and LISD members want, thriving wages, and a sustainable future for our city. And I'll send this in, because I don't have much time, but one of the things that I want to make clear that is very important to MFJ members and LISD members is that the union embraces and joins all calls of increasing and funding in LISD, MFJ, and other organizations engaged in the critical work of maintaining the social safety network of our communities and our city. And I am a born and raised New Yorker, so it's close to my heart. There can never be too much investment into our communities. Second, the union calls upon management everywhere to put the funding increases to the work by improving the wages and benefits for those doing the work, rather than investing in creating new jobs for positions that never existed, but to actually give it to those people who are actually on the ground doing the work, meeting with clients, doing home visits, and making sure people are able to stay in their houses and other issues, instead of increasing executive wages, which is currently happening and why we don't have a contract. Thank you.
Thank you all very much. You can take your seats. The next panel will be Valentina Vidal, Brady Crane, William Kornblum, Jacqueline Connor, Reverend Terry Troya, and Gabriela Sandoval Quina. Thank you. You can all get started.
Thank you, Speaker Yala, member of the General Welfare Committee. My name is Valentina Vidal, and I'm the bilingual case manager for the workforce development at JMAC. I'm here today to ask the Council's support for HRA to restore funding in the FY25 city budget for our Realizing Through Independence Through Support and Employment Rights Workforce Development Program. I'm a case manager at JMAC because of the Rights Program, and I'm also a HASA client. If the funding is not restored, 7 GMAC staff will lose their jobs, and GMAC clients will lose out on the specialized services we can provide. Founded in 1982 as a health crisis, the world's first HIV and AIDS service organization, GMAC has helped 674 HASA clients find employment by providing culture, competent, and individualized assistance, including resume building, vocational training, internship, employment, and benefit counseling, job placement, and retention assistance for unemployed and underemployed workers of all stages of career readiness. Yet, due to the administration budget cuts, as of July 1st, 2024, HRA will eliminate rights to satisfy the 283,000 peg in the January plan by cutting a 400,000 annual contract with GMAC. GMAC serves clients' population with a long history of mistrust in government, as well as healthcare-related services delivered. We have built relationships and reputation with these communities over 42 years, which is critical to our ability to be successfully manage the rights contract. GMAC has a SUNY Advanced Technology Training and Information Networking attained computer lab at our facility. Recently, our lab was completely refurnished with new computers and related technology. Attain enables clients to receive practical skills, training, and certification to succeed in the digital. Please stand with GMAC and HASA clients by advocating for full restoration of the rights program. Thank you.
Good afternoon and thank you.
Make sure your mic is on. Okay.
Good afternoon and thank you, Deputy Council Speaker.
Oh, no, hold on a second. I don't know. Is it on?
And
Yes.
yeah. And esteemed staff and council members. I'm Terry Troya. I'm a local pastor and president of Project Hospitality serving homeless people on Staten Island. I have been working with homeless people on the streets of Staten Island for 40 years. I have watched and held on to fragile bodies as their lives slipped away on the streets of our borough. I've had dinner with homeless people in sewer pipe rooms, in abandoned train cars, in huts underneath the abandoned North Shore line, and on the headstones of cemeteries. And tomorrow morning at 5 a.m., I will lead a team of 6 clergy people from Concerned Clergy of New York City to Washington, D.C., to advocate that additional federal funds come to our city for the way that we are handling the crisis of the new immigrants. But our interfaith effort is dying, and not a slow death either. We sponsor 2 of the new immigrant shelters on Staten Island since October of 2022. We've only gotten 2 months advance. We are floating 2 hotels with all of our saved money, and we can't do it much longer. We are owed $7 million, nearly $7 million, $6.9 million from DHS, $2.3 million from DYCD, and $500,000 from HRA. We are owed monies from DHS back to 22, 23, and now 24 fiscal year. $10 million we are owed. We really advocate for some strategy of some kind of rapid response team that is able to cut through the red tape and assist agencies getting the passport process in place and getting the back monies owed. We are not able to do this alone, and Passport did not input all of the budget figures. They are missing in the budget breakout. The city didn't transfer the full budget details from Accelerator to Passport, and we are stuck in the process and continue to be owed $10 million. We have exhausted all of our lines of credit. Beyond the concern of ourselves, even more so is the concern for the homeless people who fill our streets and who need supportive housing in order to survive. For us, it is very crucial that people with severe mental health issues and behavioral health issues have the supportive housing, because that is the answer to their unhoused status. So we advocate for an additional congregate and additional scatter site units, more than the 7,500 congregate units that are currently targeted by the city. We need to have parity between the services provided by New York 1515 in scatter site as well as in congregate, so that we're able to provide the wraparound services to keep people housed. We need to provide all different supportive housing models in order to get people off the street. And we advocate that we expand the qualifications for 1515 to include survivors of domestic violence. We urge the city to fully fund and staff all of the city agencies serving homeless people, hungry New Yorkers, and building and filling affordable and supportive housing. And finally, we urge a 5% COLA across all human service contracts in FY25 for $150 million set aside. We need the people to care for the people so the people don't die on our streets. Thank you.
Yeah, you guys can begin.
Hello, good afternoon. My name is Brady Crane, the confused CEO of Grand Central Neighborhood Social Services, which operates the Main Chance Drop-In Center. About 3 months ago, I enjoyed a meeting with DHS leadership discussing the positive attributes of the drop-in center and how necessary they are. About 2 months ago, I was told by DHS that Main Chance contract would not be renewed after 6/30/2024. This is the source of my confusion. After 35 years of providing a dynamic community emphasis, a client-centered approach, working with over 6,000 individuals towards permanent and transitional housing, serving over 750,000 meals and over 600 individuals receiving services 24 hours a day, 7 days a week for 35 years, I think we have something to say regarding homelessness. Main Chance is now being told to close its doors. The need for these services will not end on 6/30/2024. The experience and expertise of Main Chance will. Main Chance is requesting to maintain its current contract and to continue to offer homeless services under any name. I would like to thank the council for giving me this opportunity.
Thank you. As you know, I'm very supportive of Main Chance. My question to you, Brady Crane, is if you were to continue, would you change some of your services? Are there things that you think the city could help you do? What do you think would be the best for your clients?
Yes, we would like to go towards having beds. And we've done that working with respite bed providers. Before the virus, we were working over 50 providers and had over 100 beds. Currently, without funding from the city, we're working with an agency. What's the agency, Jackie?
Brotherhood.
Brotherhood. And they have developed their own funding, Brotherhood Temple, and they have developed their own funding, and they service 8 people out of the drop-in center. We are working with other providers to follow that same model if they have to fund their own situations. So we're right there. And also, we're looking at safe haven contracts. I'm waiting for our second feasibility study, and we look forward to being a hybrid center, whether it's Main Chance, a drop-in center, and a safe haven. We look forward to the opportunity.
Thank you, Madam Chair. This is a location that is perfect in the middle of Manhattan. Lots of people are there. Mr. Crane has an art program and has galleries and food, and you know, I feel very strongly that the $3.5 million that has been cut would be restored either as a current or safe haven or whatever is appropriate. Thank you for giving me the chance.
Thank you. Can I just say one thing?
That's up to the chair, Brady, up to the chair.
Excuse me?
Go ahead.
Oh, I'm sorry. We're having a pantry feeding over 75 families this Wednesday. I need volunteers, so if you're available, please come. Thank you.
The next panel will be Lauren Schuster, Judith Rosenfeld, Kristen Miller, and Doreen Tommen Howe.
I'm just going to submit it after.
You may begin.
Okay. Good afternoon. My name is Kristen Miller, and I serve as the Executive Director of Homeless Services United. Thank you, Deputy Speaker Ayala and members of the General Welfare Committee for allowing me to testify today. I appreciated very much the earlier questioning of the council members to DSS regarding the contracting and payment issues. I'm here today to talk about a massive issue facing our nonprofits, and that is the delay, problems, lateness of hardworking, mission-driven organizations just not getting paid for the work that they do. The commissioner mentioned that there was, so far this fiscal year, only one late contract registration. While we've seen an improvement in the rate of contract registrations timing, that is only step one of a very long process. We continue to have problems with budget amendments, problems with invoicing, problems with passport information that you've been hearing about already, and process in backlogs in this Form 65A process, which allows us to pay our subcontracted vendors. I think what's important to understand is that the members of HSU are telling me that they are owed anywhere in the range of $700,000 to $31 million from the City of New York. They are at a breaking point. They have a hard time meeting payroll in some instances because they are owed so much money from the city. And the repercussions come down to the workers in the field. A lot of our organizations have not had their WEI money put into the paychecks of the individuals, right? Because it's a multi-complex stepped process. This impacts small vendors that might be doing maintenance work and other efforts on the sites. Everyone is frustrated, from clients to executive directors. There's not one solution, but there are many. We're calling for a rapid response team to clean up the backlog. We cannot have it be done on a one-by-one basis, but secondly, we need systemic reforms. We need streamlining. We need to ease up the burden on nonprofits to get this paperwork processed. We need the city to staff up. There are not enough people back at the ranch to process all of this paperwork. And lastly, we do need to look at the cost of doing business. The City of New York is not keeping up with the state and feds when it comes to paying for the actual amount of cost, that the expenses that it takes to run shelters and homeless service programs. And lastly, our mission-driven organizations are really having a tough choice on deciding whether they should continue contracting with the City of New York or go to state and federal contracts, where it's much easier to get the contracts approved and budget and payments approved, and same with the federal government. They don't want to, but they must protect their organizations. With that, I'll turn it to my colleague.
Thank you.
Good afternoon. My name is Judith Rosenfeld, and I serve as Vice President of Special Projects for Breaking Ground, the largest developer and operator of supportive housing for low-income and chronically homeless New Yorkers. We operate more than 4,500 units of permanent and transitional housing, with 2,000 more in various stages of development.
We also operate the Street Outreach Program in Brooklyn, Queens, and Midtown Manhattan, which connects the most entrenched, long-term homeless individuals with housing and other services. There's a lot, there's a lot to discuss, but I'm mainly here today to, on behalf of Breaking Ground, to discuss how contracting and payment delays are impacting our cash flow and day-to-day operations. As of today, we are owed approximately $30 million on our government contracts. This amount increases $5 million each month. Of that amount, our receivables from the Department of Homeless Services is $28 million and includes $7.5 million in invoices pending 65A form approval. During 2023, we paid $830,000 in interest expense on our lines of credit and have paid $200,000 in the first 2 months of 2024. At the end of 2023, the weighted average of our receivables outstanding was 325 days. And like others, the biggest issue is with Passport. We are owed millions of dollars because of glitches and not being able to process our invoices and documents. So based on our current cash forecast, our available lines of credit will be fully exhausted by the end of April. At that point, we will not be able to make payroll. And so I just want to make the point that even if we do receive all the money, which we hope we do, just as we were saying before, just even the amount of funding, let's just say if we even got it all, it's just not keeping up with the true cost of operating our programs, and we're just scrambling day to day to find additional funds and be able to pay our staff. So thank you so much for the opportunity to testify.
We're taking notes, so don't freak out. Yes.
Good afternoon. My name is Doreen Thoman-Howe, and I am the Chief Operating Officer for Project Renewal, a New York City homeless services nonprofit agency. Thank you, Chair Ayala and the City Council for convening this hearing. For over 55 years, Project Renewal has provided shelter, housing, health care, and employment services to hundreds of thousands of New Yorkers experiencing homelessness. We are grateful to the City Council for supporting our programs. We are proud to have partnered with the city to address some of the biggest challenges, including the homelessness, mental health, and overdose crises. A significant portion of the preliminary budget aims to treat the symptoms of these challenges, but this approach comes at the expense of addressing the root causes. To make meaningful progress, we must improve stability for individuals and entire communities in the first place, in part by expanding access to supportive, affordable housing and employment opportunities. Access to affordable housing creates safe, stable, nurturing environments for children and families and can reduce the risk of negative outcomes later in life. A recent report from the Comptroller reveals that understaffing in city agencies is causing delays in affordable housing development. Fully funding and staffing city agencies, in addition to investing broadly in supportive and affordable housing, will go a long way to addressing our housing crisis. We also need more employment opportunities for New Yorkers to support themselves. Our workforce development programs have become a vital resource for thousands. Our culinary arts training program provides New Yorkers facing barriers to employment, including veterans, with a world-class culinary education and a pathway to a fulfilling career. Graduates go on to work in settings like corporate kitchens, local restaurants, and Project Renewal's own social purpose enterprise, City Beat Kitchens, which prepares food for other New Yorkers in need. To continue critical programs like this, we rely on nearly $400,000 in citywide initiative and speaker funding. Investing in workforce development programs generates a strong return on investment for all New York City by creating conditions for entire families to thrive. Providing these services, and most importantly, requires the commitment of frontline staff to do the work day in and day out. At Project Renewal, our housing, workforce training, healthcare, substance use disorder treatment, and mental health support services are not only life-changing, but often life-saving. Unfortunately, the workers delivering for our clients under city contracts earn poverty wages. That's why we stand with our sector colleagues to support the Just Pay campaign and give them a long overdue cost of living adjustment. During the pandemic, these workers were called essential. Unfortunately, the city contract benefit schedule treats them as dispensable. It is time to give human service workers their fair due and just pay them. We know the council is a true partner to the nonprofit sector, and in the final budget, we urge the council to increase investment in supportive and affordable housing and workforce development programs and to pay our heroic human service workers a living wage. Thank you for the opportunity.
Thank you.
As well. So,
Lauren, can you hear us? Yeah, I think you're still muted. You're muted. You're muted. We can't hear you. Lauren? Okay, we'll get back to you, Lauren. We're going to move on. Thank you.
So the next panel will be Catherine Trapani, Allison Wilkie, Arturo Brito, and Perel Bryce.
Good afternoon. Thank you for the opportunity to testify. My name is Catherine Trapani. I am the AVP of Public Policy at Volunteers of America, Greater New York, a 128-year-old anti-poverty organization working to end homelessness. Our staff is our best asset. The dedicated professionals at VOA across the city are delivering critical services to help people experiencing homelessness link to and maintain housing. Thank you for all of the discussion about payment delays. I know that we're not alone, you've already heard about it, but we absolutely need a solution. We would also really welcome your support on reversing the pegs. The commissioner testified earlier that the notion that they were gonna cut money but then allow us to reallocate to pay our staff more just doesn't make sense to me. The cuts actually wound up rolling back the investments that the council put in to pay workers a fair wage. So we desperately need those pegs to be reversed so that we can have the resources that we need to pay our workers to do the life-saving work that they're doing across the city every single day. To that end, I want to echo my colleague's call for the Just Pay campaign. We need a meaningful COLA and one that is not going to be rolled back with some other mid-year cuts. The forecasts that I've seen show much rosier tax revenues and other things, so we believe that the city should have the resources to reverse some of the harmful cuts and deliver the pay increases that our workers desperately need. We also need to make sure that our staff has the tools that they need to help clients transition into permanent housing, so we would very much welcome the implementation of the council's bills to improve access to city FAPs. Currently, about 60% of our families in shelter and 85% of the single adults that we serve cannot meet the work requirements, even though they've been scaled back. And of course, the council's bills would address that. And we know that there is a tremendous crush in our city and need for shelter capacity. But because of these stringent work requirements that the administration has refused to roll back, our clients are not able to qualify for the main way that they would exit. So I just wanted to point out that statistic because I think it's really startling. I have got other stuff in here about the need to prioritize restoring headcount and continue to meet the need at the agencies, but I'll submit some of this in writing. But I'm just really grateful to you, Deputy Speaker Ayala, and to all of your colleagues here at the Council for being a true ally to helping us in our work to end homelessness in New York City.
Good afternoon, Deputy Speaker, council members. Thank you for your time. I'm particularly sensitive to how valuable your time is. I've worked in government before, so I'm very sensitive to that. I'm going to give a brief overview first about our organization's Children's Health Fund, and then I'll talk about some concerns we have with the preliminary budget. Then I'm going to give an overview of Healthy and Ready to Learn and turn over to our Vice President, Pernell Bryce of Policy and Advocacy to give more details in the 2 minutes allotted to him. I'm Arturo Brito, President and Chief Executive Officer of the Children's Health Fund. I'm also a community pediatrician with a population health focus. The Children's Health Fund has been in New York City since 1987, and we continue to provide services throughout the city to homeless shelters, bringing comprehensive healthcare services, medical, mental, dental, and meeting social drivers of health for children and families in those homeless shelters. Our flagship program also has a state-of-the-art clinic in the South Bronx. We are focused on children and families, not only in New York City, but because of the model programs that we developed through mobile clinics, school-based clinics, telehealth, and others. We have a national network of 24 programs in 15 states, DC and Puerto Rico. Again, our flagship program is here in New York City, and we're looking to expand to other sites throughout New York over the coming years. So in terms of the preliminary budget for Mayor Adams, we understand the challenging time this is. Nonetheless, we're concerned about some of the proposed changes and reductions in the budget that are going to impact our children in the city. $221 million reduction for early child care and education, for instance, a $50 million reduction in fiscal year 25 for out years for early childhood efficiencies, $9.5 million reduction for child care claiming in ACS, and others that you have details of. So I'm going to turn over now to Mr. Bryce to talk about our Healthy and Ready to Learn program, which we have, through your support, thank you very much, since 2014, but have had in the city. And Pernell?
Good afternoon, committee. Councilwoman, it's great seeing you. Again, my name is Pernell Bryce, and I'm Vice President for Policy and Advocacy for the Children's Health Fund. As Arturo said, since 2014, we've been funded by the New York City Council for our Healthy, Ready to Learn program. This program complements our overall services to provide comprehensive health care to children, by also creating a program that really ensures that children stay in school. The focus is to address many issues that keep children out of school, many that are rooted in social, economic, racial issues. Our focus is really trying to meet kids where they are. We want to make sure that they have the resources to see, so we provide vision services. We want to make sure that they don't miss school because of dental issues. We do dental days at schools like PS 49 in your district, Councilwoman. And so our goal with HRL is also to, and I know it's important to you, Councilwoman, is address barriers like asthma that prevent students from being in school. So that is our focus as well as addressing trauma, whether it's childhood trauma or trauma in the community, gun bonds as well. And so we've been very thankful for the amount of funding that we've received in the tune of $750,000. Again, we'll be reapplying for that. But we also stand in support of many of our other nonprofits that have spoken today about the challenges of receiving funding. We've had challenges. It's been a little bit quicker this year, but we want to just say we're thankful for the funding, and we hope that you'll continue to support our other nonprofit brethren who are doing great work in this movement.
Good afternoon. My name is Allison Wilkie, and I'm the Director of Government Affairs and Strategic Campaigns with the Coalition for the Homeless. Thank you, Deputy Speaker, for the opportunity to testify. As the court and city-appointed independent monitor of the DHS shelter system, along with our partners at the Legal Aid Society, we're uniquely situated to provide insight into the impact of proposed funding for the shelter system and related programs serving all unhoused New Yorkers. We will submit full written testimony, but I'd like to focus today on 5 priorities. First, the city needs to invest more in low-barrier shelter settings, including single occupancy, safe havens, and stabilization beds. The mayor's often stated the need for creating more safe haven beds, but the city and state instead are doubling down on policing homelessness, which we know does not work. The coalition has called for at least 3,000 additional safe haven beds, but so far in FY24, according to the PMMR, the city's created only 120 new beds. Second, the city needs expanded intensive mobile treatment teams and more funding for assertive community treatment teams. Both ACT and IMT are a critical part of addressing the needs of unsheltered people with serious mental illness. But just a few days ago, we had an internal meeting about a client of the Coalition for the Homeless who has been waiting a year and a half to be connected with an IMT team. No one should wait that long, and our experience is in no way unique. Third, we're very concerned with the city's attack on the right to shelter and with the day-to-day problems we're seeing as our clients are trying to avail themselves of that life-saving right. While we acknowledge that the city has managed a significant influx of new arrivals, it doesn't relieve the city of its legal and moral responsibility to provide safe, decent, and accessible shelter to those who need it. In the past month, the Coalition has received a surge of complaints from homeless longer-term New Yorkers who either transferred from their existing placement or are newly entering the shelter system and were directed to a placement only to learn when they arrived that the shelter didn't have a bed available or that they were sent to the wrong shelter site. So this has resulted in people sleeping in chairs for days or being back out on the street, both of which are unacceptable. We're also seeing significant delays in the processing and fulfilling of requests for reasonable accommodations for homeless individuals with disabilities. So whether the cause here is insufficient budgets, too few staff, lack of training, or mismanagement, the result is the same, that people's rights are being denied. Fourth, I know we've already covered a lot in questioning about the City FEPS program and that expansion and the chronic underfunding, but I do just want to note that the city's preliminary budget doesn't include any increases based on increased eligibility from the law that the City Council passed in the fall. And I'd just like to note that the successful expansion of City FEPS really is dependent on the city fixing the delays and the hurdles that plague every step of the process and that our clients experience constantly. And then finally, to end homelessness, the city must create more affordable housing for homeless and extremely low-income New Yorkers. We're calling on the city to allocate $2.5 billion in new construction financing each year for the next 5 years for apartments to be specifically built for homeless and extremely low-income New Yorkers. That funding would support doubling the set-aside in new affordable housing developments for homeless households to 30%, building an additional 6,000 apartments per year for extremely low-income households, and accelerating the creation of 15,000 city-funded supportive housing units by scheduling their completion by 2025 instead of 2030. So we look forward to working with the council on the budget and other legislation to address the needs who are unhoused or precariously housed throughout New York City.
Thanks very much.
Thank you.
Just a reminder that we're calling all of the in-person panels first. So if we call you and you're on Zoom, you'll have an opportunity after we finish the in-person panels. So next we'll have Ron Rasmussen, Adrian Holder, Abby Bieberman, and Kathy Kramer.
You may begin.
Thank you. My name is Abby Bieberman. I'm Associate Director of the Public Benefits Unit at the New York Legal Assistance Group. I've worked with individuals and families who are attempting to apply or recertify for public assistance in SNAP and families facing eviction and seeking rental assistance, and I appreciate the opportunity to offer the following comments. As part of the lawsuit that my office filed with the Legal Aid Society against the city for failing to process applications and recertifications and issue benefits timely, and for failure to maintain systems and to complete these applications, the agency was ordered to come into compliance with federal and state processing requirements by March 31st, 2024. And last week, the mayor announced that the city had reduced its backlog significantly from over 50,000 to just over 1,500, although that number has been called into question by staff who testified earlier today. So we will look into that. A reduced backlog sounds like good news, and it is. It could be, but it does not tell the full story. We have concerns that clients are still unable to get through on the phone line to complete their phone interviews, which would result in the city processing applications in a timely manner, perhaps, but ultimately denying a large number of cases. And we've seen this in local law data, where there was an increase in the number of denials due to failure to complete the interview. But you would not know that from the numbers the administration provided last week. We are continuing to explore the phone interview and other barriers to accessing benefits as we litigate our case against the city. My written testimony includes stories of multiple clients and a NILAG attorney who reported waiting over an hour on multiple occasions and sent us screenshots to get through on the phone interview line. Some clients were denied for failure to complete their interview, and others fortunately contacted our office in time for us to intervene and conduct advocacy. But we also know that clients have submitted documents online and in person and are still being denied and discontinued. I'm almost done. So these are all clients in need who have taken repeated steps to complete their applications. They're being wrongfully denied benefits to which they're entitled. We are glad that the city is working to expeditiously process benefits, but it must simultaneously maintain functional systems for clients to complete their applications and recertifications. And please refer to my written testimony for NILAG's initiative requests, for which we are asking for renewed funding. Thank you.
Good afternoon. My name is Ron Rasmussen, and I'm the Executive Director of Legal Services NYC. Our staff of nearly 700 fights for justice for low-income New Yorkers by providing free civil legal services to more than 110,000 New Yorkers every year. Matt Desmond, the Harvard sociologist who wrote Evicted, stated, "Without shelter, everything falls apart." But we know that it's also true that without safety from domestic violence, without a sufficient stable income, and without a high-quality education and access to health care, everything else falls apart. Your funding for legal services for low-income New Yorkers allows us to help our clients hold their lives together in all the ways that are so critical. We ask that you increase that funding in fiscal year 25 to $7 million for the organizations that provide those services. We also ask that you restore funding for Legal Services NYC's Veterans Justice Project to $150,000, a return to fiscal year 2020 funding. That project began in November 2011, and since that time, we've helped thousands of veterans and their families stabilize their homes and incomes. New York City's children were hit hardest by the pandemic, and we ask you to provide $500,000 to support our Access to Education project, which will help kids with special needs and disabilities, provide language access for students and their parents, and will work with the schools to implement restorative healing programs so that children who are victims of sexual harassment or violence in the schools can be responded to with measures that are supportive and not punitive. Finally, as we testified last year, both the state and the city are dramatically underfunding the work that we do by tens of millions of dollars annually. Legal Services NYC, for example, gets roughly $30 million to provide eviction prevention services to the city. But because the case rate is so low, we need to raise an additional $10 to $15 million every year to hire sufficient staff to do the work that the contracts require. And that's just one underfunded contract. We can't keep up. You've been our partner for decades in working to meet the needs of all New Yorkers. Thanks for your help now to make sure that we're fairly paid for the work that we do to help low-income New Yorkers get and keep the benefits and services they need and deserve. And I just want to echo all of the stories that you heard about Passport and the challenges that we have had as well in trying to keep up, trying to make payroll. So thank you for your support in helping to get those issues resolved.
Thank you.
Good afternoon. Adrienne Holder, Chief Attorney of the Civil Practice for the Legal Aid Society. I want to first thank you, Deputy Speaker, and so many folks on this committee for holding this hearing and also being very engaged and active supporters of what is most dire and what's most needed right now for low-income New Yorkers is a stability in subsistence benefits or in their housing. You will receive our written testimony. We have it here today to be submitted that outlines all the restorations and issues around discretionary funding. But what I wanted to talk to you today just about was just how essential our housing justice work and shelter work exemplifies our integrated and multi-pronged approach to addressing the civil legal challenges that low-income New Yorkers face. Our housing justice, foreclosure prevention, and homeless rights units are on the ground and have helped hundreds of thousands of people remain in their homes or find a path to stable, extremely affordable housing. Our housing justice helpline advises callers in crisis and provides advice on a wide range of housing matters, including rental assistance eligibility. And for those who obtain rental assistance vouchers, we provide rights, education, and legal assistance to ensure that they use that assistance as intended and overcome any remaining barriers to housing, such as source of income discrimination, which we were able to pass with the help of this council. Importantly, the Legal Aid Society was instrumental in the creation of state-administered family homelessness and eviction prevention supplement, FEPS, and city FEPS through our Jiggets v. Grinker litigation. In addition, we collaborated with housing justice advocates to maximize our collective reach and mobilize community members. In turn, we leverage this deep knowledge and the needs and challenges of our client communities, our policy advocacy. The landmark reforms of the City FEPS rental assistance program that the City Council passed last year are just one example of the positive impact that our strong partnership creates for low-income New Yorkers. This important expansion has the potential to dramatically improve the lives of many of our clients, including tenants whose income fall in the gap between 50% of the median income and 200% of the federal poverty line. This advocacy, along with representing, you heard previously, our client, the Coalition for the Homeless, and working on subsistence benefits issues with NILAC could not be done without the support of so much of the funding we receive, and particularly the pot that is described here as discretionary, which is legal services for low-income New Yorkers, a pot that we are in with a number of other providers that we're asking for an increase this year. Again, you'll see all the other discretionary requests that are in our written testimony, but it is essential for us in the moment that we are here experiencing the crisis of shelter, as well as the affordability crisis with housing, that we are able to maintain the support that we receive from the City Council. And to echo what Ron is saying, we definitely need the Council to continue to stay with the City and making sure that the right to counsel funding is enhanced so that we can actually afford to sustain that program. And we look forward to more support from you all as we move forward. Thank you.
Good afternoon. So nice to see you, Deputy Speaker Ayala, and thank you for letting me have the opportunity to testify. My name is Kathy Kramer, and I am the CEO of Family Legal Care, which is formerly LIFT. I'd like to thank the New York City Council for its long-term support of us, without which we could not do our vital work to assist unrepresented litigants and families and caregivers who are confronting issues in New York City Family Court at the heart of their well-being, including child support, custody, visitation, domestic violence, guardianship, and parentage. The New York City family courts have been under-resourced and overburdened for decades, and 80% of litigants come to family court without a lawyer. Unrepresented litigants are disproportionately low income, from communities of color, and are often undocumented or speak monolingual Spanish. The underinvestment in the family courts, and particularly in its failure to prioritize child support services, has significant effects for the families in New York City. Child support can be a literal lifeline for many families, but it is not uncommon for custodial parents to receive none of the money that they are entitled to. Family Legal Care is the only organization in New York City doing this work. We reach almost 30,000 families every year. We have attorneys that give legal advice and consultations and provide legal information in the courthouses and on our helplines, through our library of over 60 legal resource guides in 9 languages and our innovative digital justice tools. But despite the pivotal role we play to increase access to justice in family court, family legal care is now facing a potential significant loss of critical funding from the Mayor's Office due to a transition of our contract from the Mayor's Office of Criminal Justice to the Mayor's Office to End Gender-Based Violence. We urge the Council to increase discretionary funding in the upcoming budget cycle to ensure that we can continue to serve the thousands of families who rely on us. We wrote much more about that in our written testimony. Strong families are essential building blocks for a thriving city, and with your increased support, family legal care can continue to be part of the solution. You've always been very generous to us, and we so appreciate that and look forward to working with you in the future. Thank you.
Thanks very much. Our next panel will be McGregor Smith, Omarax Rosa, Antonia House, and Anna Arkin Gallagher.
You may begin.
Afternoon. My name is McGregor Smythe, and I'm the Executive Director of New York Lawyers for the Public Interest. I just wanted to open by thanking Deputy Speaker Ayala and this committee and the Council for really being a champion for the critical legal services, civil legal services in particular, for New Yorkers in need. Including NILPEs, which combines law organizing and the power of pro bono legal services as well as medical services to help New Yorkers achieve justice. We are a proud part of the New York City Council's Immigrant Health Initiative, which serves both recent migrants as well as immigrant communities across the city. And through the Council's leadership, NILPE advocates have both saved lives and improved healthcare across the city. Instead of talking about numbers, which we'll do in our written testimony, I really wanted to spend the short time together lifting up the people who really benefit from the Council's leadership. One of our clients, recent clients from Elmhurst, is Mrs. G, who came to NILPE after her diagnosis with end-stage renal disease. She had lost her ability to work as a nanny and to earn a livelihood, and was enduring this just really horribly depleting dialysis regimen. She was undocumented and uninsured and unable to access the health care that she needed for a longer-term solution, which was a kidney transplant. So after a legal assessment in our office, our staff found a pathway to gain her access to health insurance and to change her status. Filed an immigration application, got her on health insurance, and also through advocacy got her on a kidney transplant list. And I'm incredibly happy to report that just this past December, she received a successful kidney transplant and is now living happily at home with her family and feeling a lot more healthy. This is just one story among many from NILPE and our initiative partners, and we're asking for an enhancement to support this really important work. And I also just wanted to echo our other partners who just testified about the critical need for funding fairness to support the advocacy and incredible work of our staff. Thank you.
Hi, good afternoon. My name is Anna Arkin Gallagher. I'm a supervising attorney and policy counsel in the civil justice practice at Brooklyn Defender Services. Thank you to the committee and Deputy Speaker Ayala for the opportunity to testify today. BDS is a public defense office representing people in criminal, family, and immigration matters. Our civil justice practice provides legal and social work services to our clients to minimize or prevent collateral consequences and ensure that the people we represent can keep their jobs, stay in their homes, and support their families. We echo our colleagues' request that the city increase support for civil legal services, but urged the city to also invest in opportunities to fund organizations in ways that allow providers to intervene to resolve issues before the need for litigation arises. As an example, we routinely address public benefits issues for our family defense clients whose children are temporarily removed from their care, ensuring their public assistance budget for rental assistance and housing vouchers remains unaffected despite a temporary change in household size. Without intervention, children are removed from their parents' budgets without notice, resulting in rent not being paid and eventually in non-payment proceedings being filed, often before the family is even made aware of this issue. We believe full representation is essential, but tying access to legal representation only to court appearances misses opportunities for earlier, more efficient resolution of issues that can avoid future court proceedings entirely. We're grateful to Speaker Adams and the Council for the generous Speakers Initiative funding to support our clients, allowing us to provide interdisciplinary representation, including the early intervention assistance referenced above. We ask that this funding be renewed. BDS also receives discretionary IOI funding in support of our immigration practice. We continue to expand services to meet our clients' needs, including focusing on enforcing low-wage immigrant workers' rights and also seeking deferred action for workers who are experiencing labor exploitation. We've seen dozens of clients whose employment claims have also led to meaningful immigration relief, including obtaining work authorization, as well as the administrative closure of their removal proceedings, where it would otherwise not be possible. We ask that the Council increase this funding to allow us to expand this work. Thank the City Council for the opportunity to testify today and for your continued support of the people, family, and communities we represent. Our written testimony further elaborates on the critical interventions we provide to clients with criminal, ACS, and immigration matters. Thank you.
Good afternoon, Chair Ayala and esteemed members of the General Welfare Committee. My name is Omarix Rosa, and I am the Director of Housing Justice at the Harlem Community Justice Center, a program of the Center for Justice Innovation. Economic justice is a crucial component of what allows a community to thrive. Housing instability and poverty impact individuals greatly. While many programs have been made available to support low-income families, the provisions of such have been diminished by a myriad of issues. By addressing issues early, we keep people safely housed and avoid the legal system involvement. The center serves as a bridge between the system and the communities, developing strategies to advance access to justice and improve economic housing security. Today, I will be discussing the main issues that the center staff see residents seeking to resolve: housing voucher program, the one-shot deal, SNAP replacement, and also the dearth of affordable housing. We ask the Council ensures that nonprofits like the Center for Justice Innovation and city agencies doing this valuable and meaningful work are adequately supported in this year's budget. New York City is in a housing crisis. Less than 1% of apartments are priced below $2,400 a month, making it only affordable to those who make $60,000 a year or more. The Harlem the Harlem Community Justice Center and the Center for Justice Innovation, after years of tackling our clients' housing concerns at every level, the center stands ready to enhance its partnership with this council to better address the housing issues for New York. It is critical to ensure housing courts and resource centers are accessible, fair, and are able to have the much needed assistance and resources available to the community. The Center for Justice and Innovation looks forward to continuing to partner with the council to ensure that New Yorkers can live safely and securely in their homes. Thank you for the opportunity to testify.
Okay, thanks very much. Our next panel will be Greg Silverman, Kim Mascaritolo, Nicholas Buse, Jerome Nathaniel, and Paula Inhargu.
Thank you to the General Welfare Committee and Chair Ayala for holding the budget hearing and the opportunity to submit testimony. My name is Greg Silverman. I'm the CEO of the West Side Campaign Against Hunger. Been working in New York City for 45 years. Our organization, now we feed about 80,000 New Yorkers in need, over 2.2 million pounds of fresh produce, which is 50% of what we give out, because we know that healthy food is important to our customers and our community. We're focused not just on a choice of apples or bananas, but on a location of service, delivery models, and the time spent securing food. And this choice isn't just an economic win for everyone, it's also a health win. We did a recent study with Columbia University, and the findings are showing an improvement in food security is linked to increased frequency of fresh vegetables and fruit consumption. Supports the idea that food security outcomes in future interventions to reduce diet-related chronic diseases. Investing directly in nutritious food for and with direct service providers can lead to improved well-being for New Yorkers in need. We work as a network as well as part of the roundtable with 7 of the other largest emergency food providers in the city, such as New York Common Pantry, Met Council, POTS, Project Hospitalities, and others. And we all track pricing to push for better product across the network, and it's really important. But, you know, we collaborate well, we do great research, we're feeding people, but, you know, the truth of the matter is we're all struggling. In West Side Campaign Against Hunger alone, this summer we served 42% more people than we did the previous year, which was nearly double what we served before the pandemic. The numbers are not going in a positive direction. You heard it earlier today, you know, the CFC program, Community Food Connections, is an essential program. Any thoughts that it'll be cut or adapted based on trusting words like the commitment from the city or adequate levels, like we know that the 50-odd million that we have right now is still not enough. We need at least 60 million to keep it where it should be. Further, we want to make sure there's no cuts to school food, the $60 million cuts. Those have been huge wins. And thirdly, just HRA, as you've heard, we want to see more support to HRA staff members because truth of the matter is just clearing up the backlog is not nearly enough. The truth is we should be best practice at this, and that's because our customers deserve it. So we have to get more staff to provide more supports to customers in need. Thank you.
Hi, Chair Ayala. Thanks so much for giving me a moment. I'm Nick Buse. I'm the Director of Government Relations at the Food Bank for New York City. Thanks to your great staff for all of their hard work on these really important issues. I'll say just very briefly, Food Bank serves about 800 food pantries and soup kitchens across the 5 boroughs. Those food programs are seeing an 80% increase in visits from before the pandemic still today. And the sad reality is that the food supply that we have available across the city has decreased, which is why it pains me to say that we don't onboard new members. There's about 200 organizations that have reached out to us and said, hey, we're distributing food, we have community need. And we say, we don't have the food for you right now. So like Greg says, investing in community food connection is essential. I want to thank you for your questions to HRA about NYC benefits as well. That's an essential program. We believe that community-based organizations are the front door to the community, and when organizations are serving food, that's a great way to get people in the door. So thank you for continuing to advocate for that. We support a $10 million investment in that and ensuring that the current organizations that are doing that work can continue to do that work. I'll stop there. Thanks.
Good afternoon. Thank you so much for having us here today to testify on the Mayor's preliminary budget. My name is Jerome Nathaniel. I'm the Director of Policy and Government Relations at City Harvest. City Harvest is one of New York City's largest food rescue organizations. This year, we're on pace to rescue over 77 million pounds of food, perfectly edible food, mostly fresh produce, and delivering that to a network of over 400 emergency food programs across the 5 boroughs. Unfortunately, even as we're ramping up our services to be 20% higher than it was before COVID, we know that's simply not enough. It's not fair, and nor is it possible for emergency food providers and community-based organizations to make up the gap in place of effective, efficient, and equitable public policy. And we think there are a number of ways that the budget can invest in the fight against hunger. So it's written in depth in my testimony, and you presented a lot of strong, important questions to HRA about it earlier today, but I do want to go through some of them. So first and foremost, we're very concerned about staffing at HRA. We think that it's critically important that they go above and beyond the backlog and really make sure that it's well staffed and they're recruiting and retaining staff, because the fact of the matter is, for every meal that we provide, SNAP provides access to 9 meals, so it's really important that the city is doing its part to really invest in enrolling people into the SNAP program. Secondly, this might sound familiar, we're all in the same anti-hunger community, but we're asking for Community Food Connections to go up to $60 million. Even while pantry visits have increased by 80%, we're not asking the city to increase CFC funding by 80%. We're simply asking for a really modest $5 million increase or so to meet the increased cost of operating the program and also to the increased demand for emergency food across our city. We're also asking for the city to really do its best to leverage state, federal funding, any funding to really support the response to new arrivals. Many of our program partners are seeing a huge increase in demand at zip codes that are near shelters and HERC sites, so it's really important that the city really reimburses or supports them in that response. And then finally, I do also want to make an ask in solidarity with No Kids Hungry. We're asking for the city to restore $60 million that was proposed to be cut from OF&S. School meals are important, child hunger is up, and a lot of those same families are going to City Harvest Pantry programs. Thank you again for this time.
Thank you so much to Chair Ayala for having this hearing. My name is Kim Oscaritolo. I'm the Director of Communications and Advocacy for Hunger Free America, and I am grateful to be here to submit this testimony on behalf of the estimated 1.28 million city residents who now struggle against hunger. Our message is very simple. New Yorkers are facing massive hunger and food insecurity crises citywide, and we need a massive response from the city, especially one that focuses on increasing participation in the federally funded SNAP, WIC, school breakfast, and summer EBT programs. According to the most recent USDA data, 1 out of every 5 children in New York City experiences food insecurity, while more than 1/4 of children in the Bronx are food insecure. Food insecurity among employed adults increased in nearly every borough compared to 3 years ago. By far the most impactful and cost-effective way for the city to fight hunger is to increase participation in the SNAP program, formerly known as food stamps. Doing so would dwarf any other effort. If current caseloads and benefits levels stay the same, federal SNAP spending in New York City over the next year would be $4.9 billion, which dwarfs city and private spending on charitable food. So in our submitted testimony, we offer lots of facts and figures about hunger in New York City, but to close out, I want to focus on our recommendations for how the city can best fight hunger. First, increase funding to nonprofit groups that increase access to government food benefits through the NYC Benefits Program and direct city council funding. Accelerate the city's promised work to create a My City portal to allow application for multiple benefits at the same time online. We urge you to urge the state to end the subminimum wage for tipped food service workers, to enact and fund a SNAP-like program to be funded by the city to give extra grocery funds to immigrants who may not be eligible for federal SNAP benefits, to ensure that all classes in New York City public schools provide either in-classroom school breakfast or grab-and-go breakfast in the hallways, and finally, work with nonprofit groups to launch a comprehensive outreach and enrollment campaign to ensure robust participation in the new summer EBT program. Thank you very much.
Thank you, Chair Ayala, and members of the committee for having this hearing. My name is Paula Inargue. I'm a policy analyst at United Neighborhood Houses. United Neighborhood Houses is a policy and social change organization that represents neighborhood settlement houses that reach 770,000 New Yorkers from all walks of life. Our members provide a wide variety of services to their communities, such as providing support to access benefits and case management for HRA programs, including those that address food insecurity. My testimony will focus on the New York City Benefits Program, and my written testimony goes into more detail and includes additional recommendations regarding food assistance and benefits access. Settlement houses and community-based organizations play a vital role in bridging the gap between the government and the community. And New York City Benefits, it's a program that formalizes that relationship. It supports community outreach and benefits enrollment in neighborhoods across the city. Through these programs, CBOs deploy dedicated staff members to help their community access benefits such as SNAP, cash assistance, and affordable housing, among others, with a holistic approach that addresses various areas of need. Having in-person and one-to-one support for an individual navigating benefits applications results in fewer errors and more successfully completed applications, as well as greater outreach in communities, thus increasing the number of people receiving the benefits to which they are entitled. New York City benefits providers have cited the promise and early results of this program and cite the collaborative nature with HRA as a great strength and potential model for other human services programs moving forward. In late December of 2023, HRA made a significant announcement regarding the freezing of funding for year 2 of the New York City benefits program due to the city's fiscal challenges. This decision posed both financial and operational risks for settlement houses and other CBO providers, placing them in a precarious and uncertain position. A month later, HRA issued a new notice stating that funds would be unfrozen only through June 30th, without a guarantee of sustained funding beyond that date. It is crucial that all 36 grantees have their contracts funded after June 30th, recognizing the ongoing need for the program. This current list of contracted CBOs has proven that having a wide pool of providers gives the program a broader geographical reach, helps support specific populations with specific language and cultural needs, and provides several touch points throughout the city. That is why the city must maintain $10 million for the New York City Benefits Program in FY25 and ensure all 36 CBO providers are able to continue their essential work. They must provide clarity and end the uncertainty that CBOs and staff have been grappling with for the last couple of months, allowing programs to plan ahead for the new fiscal year with sufficient time and certainty. Thank you for your time.
Thanks very much. Our next panel will be Kathy Vargas, Anna Kaganova, Nafisa Rahman, Meredith Levine, and Michelle Burney.
Good afternoon, Chairperson Ayala. My name is Kathleen Vargas, and I'm speaking on behalf of Center for Family Life in Sunset Park. We're a neighborhood-based organization and settlement house that has been the principal provider of integrated social and human services in Sunset Park, Brooklyn for over 45 years. CFL provides a comprehensive range of wraparound family and social services to meet the needs of low-income communities, the low-income community serving more than 15,000 people yearly. Sunset Park is home to large Latino and Chinese populations, which make up the majority of our clientele. 23% of residents and 25% of our neighborhood children live below the poverty line. 30% of our households receive SNAP and other public benefits. The New York City Benefits Program has been instrumental in enhancing the well-being and quality of life of low-income families in Sunset Park. Our holistic and compassionate approach is something that our clients simply cannot find through online applications or self-service kiosks, which often present language and technical barriers. The proposed cuts to the New York City Benefits Program threatens to exacerbate disparities among our community's most vulnerable members. This is why we implore the city to continue its support, not just for CFL, but for all 36 agencies involved in this critical program, with a commitment of $10 million in funding. CFL's wraparound support addresses multiple areas of needs, is grounded in respect for cultural nuances and language accessibility, and is essential for the thriving future of Sunset Park's residents. Continued investment in the New York City Benefits Program will ensure us to further our mission in decreasing disparities and enhancing the stability and well-being of the families we serve. We stand ready to continue our work to foster a community where every member has the opportunity to live a life of dignity and full potential. Your support is not just a funding decision, it is a commitment to the health, stability, and prosperity of our community. Thank you.
Good afternoon. My name is Nafisa Rahman and I'm a student at Hunter College. I am currently enrolled in the Welfare Rights Initiative Community Leadership Training Program, and on behalf of WRI, we thank you for your work for our city. WRI's mission is to sustain the economic security of families and reduce income inequality to level the playing field. We believe NYC, NYS, CUNY, and WRI have a collective purpose to review policy implementation barriers, surface viable solutions, and create a plan of action that immediately stabilizes and supports low-income students in danger of dropping out of CUNY due to misinformation and the current political climate. This poignant and dynamic and troubling time offers a unique opportunity to put forth economic and education policies that uphold our shared values and beliefs and protect families enduring financial crises. WRI's community leadership classes taught me many lessons about connecting with the community. For example, on November 29 last year, my classmates and I organized the Day of Action at Hunter College. The #1 supportive service that the students shared is the need for free Metro cards for all CUNY students. WRI believes that together we can secure positive welfare policy changes and showcase the self-determination and dignity of all families regardless of their socioeconomic status. Some recommendations are mentioned in my written testimony, but I do want to emphasize that HRA must provide clear language in all written and verbal communication with welfare participants, clear, concise, and consistent communication of education opportunities, and the supportive services needed to continue college matriculation is a lifeline for low-income and welfare-eligible families. Thank you for your time.
Good afternoon, Deputy Speaker Ayala and members of the New York City Council Committee on General Welfare. My name is Michelle Bernay, and I'm the director of the Benefits Plus Learning Center at the Community Service Society of New York. The Benefits Plus Learning Center at CSS has been at the forefront of benefits access work for 30 years, training social service providers in public benefits and housing programs through workshops, publications, and case consultation. Thank you, Deputy Speaker Ayala and Councilmember Hudson, for highlighting the NYC Benefits Initiative today. Thank you for the opportunity to testify on the importance of continued funding for this initiative for the duration of the 3-year period that was originally envisioned. This project is groundbreaking. It's an expansive, first-of-its-kind partnership between the city, 36 CBOs across the city, and technical assistance providers with benefits, legal, and policy expertise. As a TA provider, we work closely with our cohort of 12 CBOs, including Center for Family Life, DSS staff, and the other 2 TA providers. The nature of this initiative is consistent with the work that BPLC has been doing since its inception, working closely with social service providers so they can assist their clients with public benefits access and advocacy. The training curriculum spans all public benefits and all of their complexities, as well as housing programs, the Access HRA portal, trauma-informed care, and more. The case consultation that we provide allows us to often assist the social service providers prior to requiring any escalation with our DSS partners. And when escalation is required, our DSS partners are caring, compassionate, and tremendously responsive. And for that, we are grateful. When we are doing case consultation, that really enables us to spot any emerging trends, and also it allows us the opportunity to brainstorm on possible systemic changes. This project has the potential to significantly expand New Yorkers' access to urgently needed benefits, and continued investment is essential. We commend the Adams administration's commitment to benefits access and its understanding that a longer-term project such as NYC Benefits is needed to realize systemic change for the benefit of all New Yorkers. CSS is honored to have the opportunity to work on the citywide initiative to bring about strategic improvements to the benefit system at all levels. Thank you.
Good afternoon, Chair Ayala and members of the committee. My name is Meredith Levine, and I'm the Senior Director of Information and Case Assistance and oversee the NYC Benefits Program at JASA. JASA is a not-for-profit agency that honors older New Yorkers as vital members of society, providing services that support aging with purpose and partnering to build strong communities. For over 50 years, JASA has served as one of New York's largest and most trusted agencies serving older adults in the Bronx, Brooklyn, Manhattan, and Queens. Last year, JASA was fortunate to be one of 36 grantees awarded the NYC Benefits contract through HRA. NYC Benefits' mission is to eliminate any barriers getting in the way of New Yorkers accessing benefits and entitlements, and works to help all who are eligible obtain and maintain their benefits over time. Our work at JASA specifically focuses on the older adult community, and we specifically target the plethora of barriers facing the older adult community when trying to access and sustain their benefits. Whether that means providing home visits to homebound seniors in an effort to obtain documents and signatures for applications, or simply setting up email accounts and access HRA accounts for older New Yorkers who are not so tech savvy. Maybe they have a lack of Wi-Fi or a lack of knowledge, or simply because they still use a landline and a flip phone. Older New Yorkers, when it comes down to it, are simply more comfortable talking to a live person than uploading documents through an app. Our NYC Benefits program at JASA has touched the lives of over 400 older New Yorkers in our first year of operation, educating them about public benefits and entitlements, screening them for eligibility, assisting with documentation retrieval and application submission, and advocating on their behalf to address incorrect denials or inaccurate budgeting decisions. This work was done in the homes of dozens of older New Yorkers, over the phone and virtually when a caregiver was available to assist, texting us pictures and tracking down documents, and on site at JASA's network of older adult centers, NORCs, and subsidized senior housing buildings, all to bring these services to where seniors naturally congregate. Because of this funding, JASA's NYC Benefits program ensured that older New Yorkers benefited from SNAP, Medicaid, SCREE, one-shot deals, transportation benefits, utility benefits, Social Security benefits, and the Medicare Savings Program. And we did this with the expertise and cultural sensitivity required to successfully gain the trust and confidence of older New Yorkers. We are here today to ensure that the NYC Benefits program continues in its present form to ensure New Yorkers receive skilled, person-centered assistance to access and maintain life-sustaining public benefits. We ask that HRA continue to receive the $10 million to preserve the NYC Benefits program and continue funding of the current 36 grantees. Thank you for the opportunity to provide this testimony today.
Great. So we have one more. Is that everyone on this panel? Okay, great. We have one more in-person panel. So if there's anyone who is here in person that would like to testify before we move on to virtual, please get a slip filled out from the sergeants in the back. Otherwise, our last in-person panel is Tawaki Kamatsa.
Hi, I'm Tawaki Kamatsu. I'm sitting in the seat that Scott French of HRA was sitting in earlier today. After he sent an email on October 25th of 2017 at 8:54 a.m. to other City of New York personnel to collude and conspire with them to illegally keep me out of a public meeting in Brooklyn. That email reads, "Hi, Rachel, Molly, and Commissioner Carrion. I just wanted to make you aware that Mr. Kamatsu, who has attended several events where the mayor and Commissioner Banks are in attendance, indicated at a Access to Council team last night that Commissioner Levine and Commissioner Perkins held that he was planning on attending today's resource fair and expected that he wouldn't be allowed to the fair. Wanted to flag for you so you could let Redmond know, who is very familiar with Mr. Kamatsu. He may ultimately not show up, but wanted to flag as a possibility." Yesterday, I was in this room 10 days ago. I talked to you, Ms. Ayala. Yesterday, I sent you an email earlier today. I got assaulted in a MICA shelter. 10 days ago, what did I talk to you about? I talked to you about being in a MICA shelter. I told you you weren't doing anything about that problem. I got a really nasty punch to my head yesterday. I was bleeding all over the floor. You had, what's her name, the commissioner of DSS here today, lied straight to your face. I've had fair hearings. She complimented OTDA. The fair hearings are with OTDA. OTDA currently employs DSS's former general counsel, Martha Calhoun. I also talked to Anne Marie Scalia, the current general counsel. She basically BS'd me today in this room. So this is a budget hearing. And in terms of a quorum, this is a public meeting, a public forum. Where are your coworkers? Empty seats all around? So one of the prerequisites for having a public meeting is having a quorum. Your coworkers are nowhere to be found. The woman over there, she was just having a side chat with, I think, Rita Joseph over here, not paying any attention to someone's testimony. So with regards to the shelter that I'm currently in, it has a $38 million contract. It's run by VIP. I don't know what that stands for. But they regularly don't have toilet paper in the bathrooms. They don't have soap in the soap dispensers. The meals are minimal. So where the heck are they spending the money? And when I got assaulted, no first aid kit. Blood was dripping all over the freaking floor. I asked for an ice pack. Sorry. So what exactly are you going to do and when to prevent people who don't have mental illness, don't have a drug abuse problem, don't have any criminal background from being coerced to reside in MICA facilities that are basically a freaking time bomb? I talked to Ms. Holder, Adrienne Holder, who was here. I specifically asked her, what can you do, maybe commence litigation against DHS? She basically stonewalled me and referred me to Coalition for the Homeless. Josh Goldfein of Legal Aid referred me to Coalition for the Homeless. They didn't follow up. That was like a week ago. And then I got a swift punch to my head yesterday. So what are you going to do?
I'm sorry to hear about your incident yesterday, and I hope that you got that checked out, and your time is over.
Even though you let other people go past their time limit?
I let you go over your timeline.
Okay. So New York State Supreme Court Judge Lyle Frank, please void today's hearing. Thank you.
Thank you.
Oh, by the way, see this? That's the blood from the freaking assault.
And now we have Gabriela Sandoval Requinua. Thank you.
Good afternoon, Committee Chair Ayala and committee staff. Thank you for holding this hearing and for the opportunity to testify on behalf of New Destiny Housing. My name is Gabriela Sandoval Requena, and I am the Director of Policy and Communications at New Destiny. Our mission is to end the double trauma of abuse and homelessness among domestic violence survivors. We do this by developing supportive housing for survivors in shelter, assisting those who are fleeing abuse, obtain subsidies, and find safe new homes, and advocating for new housing resources. New Destiny is also a co-convener of the Family Homelessness Coalition, as well as a member of the Supportive Housing Network of New York. Why do we do this work? Because despite the fact that only 50% of domestic violence cases are reported, the NYPD filed one domestic violence incident report every 2 minutes in 2022. In other words, since this hearing started, more than 150 survivors called the police to file a situation of abuse, and countless others went silent. Because of domestic violence, thousands continue to enter shelter system in New York City. We know that access to safe and affordable permanent housing will determine whether survivors leave their abuser and rebuild their lives. We will submit extended written testimony, so I just wanted to use this time to highlight our 5 key takeaways. First, we're deeply concerned with HRA's limited capacity, which has delayed check processing times, slowed moves from shelter to permanent housing, and impacted the success of rental assistance programs. Second, we call on the administration and the council to please fund the Housing Stability Program for survivors of domestic violence, also known as the Microgrant Program, at $6 million in fiscal year 2025. Additionally, we want to call attention to 2 administrative solutions that will improve timely access to affordable housing and not cost the city anything. One is to allow survivors of domestic violence to access HPD homeless set-aside units, as the mayor promised on the Housing Our Neighbors Blueprint back in 2022, and open city-funded supportive housing to domestic violence survivors and their children who are not currently eligible for NYC 1515. New Destiny, last but not least, New Destiny also supports the network's recommendation to improve NYC 1515 with the housing vacancy rate at 1.4%. The city must develop additional congregate units above the original commitment of 7,500 homes. Thank you so much for your time.
Thank you. So we'll now be moving over to virtual testimony, and just a reminder to please identify yourself before you begin your testimony for the record. Our first virtual panel will be Union Strong, Gloria Kim, Antonia House, Tiara Labrada, and James Dill.
Starting time.
Good afternoon, Chairwoman Mayala. My name is Tara Joy. I'm a member of the unionized staff at Mobilization for Justice. Our union comprises 110 members from front desk staff to senior attorneys who work in a number of different practice areas, with 4 major focuses being housing, economic justice, disability and aging rights, and children's rights. Last year alone, we served 15,000 households citywide. With that said, I'm not just here today to talk about the work that MFJ handles fighting evictions, helping asylees gain permanent residency, helping families stay together, and shining a light on deplorable conditions in adult homes. I'm also here to talk about why myself and 109 of my colleagues have not set foot in our offices nor spoken to any clients since February 23rd. I'm here today to talk about our strike. While we are incredibly proud of the work we do, our staff is at a breaking point. In the past year, MFJ lost 23 employees and currently has 17 open positions, many of which have gone unfilled for months. And yet the contractual offers made by our management would do nothing to alleviate this constant turnover, as we all know that 2% salary increases are not sufficient to keep up with the cost of living in New York City, nor to attract and retain the workers we so desperately need. The irony of having to fight for fair and equitable wages from an employer whose mission statement claims to envision a society in which there is equal justice for all is not lost on us. Having witnessed it firsthand, I really want to hammer in the impact of staff attrition to an organization like ours. When an attorney quits, in the short term, their colleagues have to stretch themselves thinner by absorbing their caseload. In the medium term, while that position remains empty, our capacity to take on new clients is reduced by that much more. And in the long term, the faster staff burn out and leave, the harder it is to cultivate the kind of legal skills and knowledge that produce truly life-changing advocacy for New Yorkers, skills that only really come with years of experience. In closing, I'd like to clarify that the union knows that MFJ's management has asked the city for funding increases, and we fully support these asks. The reason for our presence here is to remind the city, the council, and our management that any increases in funding should go to the workers fighting for your constituents and not to the executives who caused this strike. We'd like to give a special thank you to council members Banks and Ressler for joining us on the picket line, and extended invitation to all those who have yet to join us. Thank you for your time.
Our next virtual witness will be Gloria Kim.
Starting time.
Good afternoon, Deputy Speaker Ayala and members of the New York City Council General Fair Welfare Committee. My name is Gloria Kim, and I'm the Director of Policy Research and Impact of the Human Services Council, a membership organization representing over 170 human services providers in New York City. We thank the City Council for the $100 million workforce investment in the last 2 years and the commitment to an additional $50 million in the fiscal year 25 budget, which is a step forward in fairly compensating frontline workers who have been providing services to millions of New Yorkers. However, the workforce investment is not a true cost of living adjustment with a guaranteed percentage increase for all contracted human services workers. A COLA is a significant step to address the historic underfunding and lack of investment in the human services sector, as these workers do some of the most important jobs in our communities, yet are underpaid and undervalued. As government is the predominant funder of human services through government contracts, this has resulted in nearly 25% of all human services workers qualifying for food stamps in 2016 to 2018. Low wages also have a sweeping effect on workplace conditions and the outcome of programs, with high staff turnover and vacancy rates resulting in heavy and unsustainable workloads. Government contracting practices have resulted in an intolerable situation of extreme pay disparities where human services workers make an average 71% of what government employees make and 82% of what private sector employees receive. With a threat to sustainability and deficiency of resources, the sector faces recruitment and retention issues, impacting the overall viability of organizations and program services. So a 5% COLA in this year's budget and a 3% COLA each year for the next 2 years on the personal services line of all city-funded human services contracts are needed to ensure this vital workforce does not slip further into poverty. The lack of COLAs and livable wages for workers not only disadvantages communities who rely on these workers for life-saving services.
Thank you. Time expired.
Okay, thank you.
Next, we have Antonia House.
Starting time.
Hi, my name is Antonia House. I coordinate SILEC, which is a collaborative of 13 legal service providers and CBOs that work together to strengthen low-income immigrant communities in the city through employment and immigration legal services, outreach, education, and advocacy. Our work is funded by the Immigrant Opportunities Initiative, the baseline contract that's administered by DSS's Office of Civil Justice. It has been a successful contract serving thousands of New Yorkers over the last 8 years and is now scheduled to be put through an open bidding process. This open bidding process creates an opportunity to respond to the challenges that the contract has faced and the new social and economic landscape we're dealing with now, and to reverse the funding stagnation and the disinvestment of $2 million from employment-related legal services. Providers funded by this contract have issued a series of recommendations to DSS, and we would like to share those with the committee now and also in my written testimony. So first, baseline IOI must be funded at a level that allows legal service providers to pay staff fairly and to provide adequate funding for supervision, language and administrative support, as well as community outreach, education, and advocacy. Second, DSS must reinvest in baseline employment-specific legal services as part of this contract. These services are necessary to fight wage theft in the city, an enormous strain on our economy, and an obstacle to the economic stability of new immigrants in particular. And finally, while the contract must credit pro se assistance, it must continue to prioritize full legal representation, because while pro se assistance can help us meet urgent deadlines, it won't ultimately stop the creation of a new generation of undocumented New Yorkers, because most unrepresented people in removal proceedings will ultimately be ordered removed, but not actually deported from the United States. This means that they'll remain here with removal orders, lose their employment authorization and a clear path to lawful status, and face an incredibly precarious future. In contrast, people who are—
Thank you. Your time has expired.
Thank you.
Thank you. Next, we have Tierra Labrada.
Starting time.
Good afternoon, Chairperson Ayala and members of the New York City Council on General Welfare. My name is Tierra Labrada. I'm the Associate Director of Advocacy at the Supportive Housing Network of New York, a nonprofit organization representing the developers and operators of supportive housing. And we are concerned that the NYC 1515, the city's primary mechanism for supportive housing development, is falling short of its goal to create 15,000 units by 2030. 1515 relies on the scattered site model, where nonprofits rent units on the private market and bring services to tenants. Yet the private market units just aren't there, as evidenced by the recent housing and vacancy report that show that rental vacancies in New York City are at just 1.4%. This, along with inadequate service rates, has resulted in only 17% of scattered site units awarded after 8 years, when the city should be above 50%. This is not just about slow production, it's a racial equity issue. Black people are overrepresented in supportive housing applicants and make up the majority of tenants. Failing to cover the true cost of operating these programs means failing those that the city has promised to support. But the network has developed a comprehensive reallocation plan that would improve 1515 and ensure that the city reaches its target. We are seeking to reallocate the unawarded scattered site units as follows. Develop additional congregate units above the original 7,500, which would add to the city's supportive and affordable housing stock. Develop only a limited number of scattered site units to be rented on the private market, accounting for the low vacancy rate and the instability of the model, as I mentioned. Using 1515 services and operating, develop a dedicated supportive housing preservation program at HPD, and investigate an affordable housing overlay model where scattered site contracts can be paired with city-funded homeless set-asides. We are also seeking to increase and align all NYC 1515 service and operating rates to ensure parity across the program and all housing models, and expand the eligibility of 1515 to include individuals exiting jail or prison and survivors of domestic violence. Finally,
Thank you. Your time has expired.
Our predominantly Black and brown workforce deserve fair compensation. We are calling with our colleagues for a 5% COLA for city contracted human service workers in FY25. Thank you so much.
And next we'll have James Dill.
Starting time.
I'm Jim Dill, Executive Director of Housing and Services, Inc. We are a permanent supportive housing provider with 625 congregate units and 100 scatter site units. Permanent supportive housing is a time-tested, most cost-effective, and humane way of ending chronic homelessness. We are members of the Supportive Housing Network in New York, and we support all the network's advocacy points for this hearing. I urge the committee to support the proposed reallocation of NY 1515 housing units and resources. The city's 1515 initiative to create 15,000 supportive housing units within 15 years is both a necessary step to end homelessness. However, its 50-50 allocation to congregate and scatter site housing is not sustainable, as the current market does not provide acceptable housing units to support the 7,500 scatter site unit allocation. We constantly struggle with our current scatter site program to find and maintain acceptable housing units. We constantly fear that market conditions could ultimately make us a provider of substandard housing. In that event, we would be part of the problem and not part of the solution. We have no intention in applying for 1515 scatter site units. We applaud the 1515 congregate program, which is fundamental for the development of our newest 107 unit project. We are seeking to apply again with the new congregate project. The 1515 program is crucial. It should not fail due to the flawed 50-50 allocation. We urge the committee to support the reallocation of 1515 scatter site resources to new congregate units and to provide for the preservation of our first generated supportive housing that desperately needs additional funding to comply with Local Law 97. I thank you for your time. We will submit written testimony.
The next panel will be Lauren Schuster, Melanie Samuels, Natalie Pierre-Louis, Judith Sikhan, and Rachel Bryant. Lauren Schuster will be first.
Starting time.
Good afternoon. I'm Lauren Schuster, the Vice President of Government Affairs at Urban Resource Institute. Thank you, Deputy Speaker Ayala, committee staff, and members of the General Welfare Committee for the opportunity to testify today. URI is the largest provider of domestic violence shelter services in the country, and we're also a leading provider of transitional housing to families experiencing homelessness. We are committed to ending the cycles of violence and homelessness, and we help families to achieve economic wellness. We work with youth and in communities to interrupt cycles of violence, and we are committed to engaging people who have caused harm in the solutions to end violence. The rates of homicide and felony assaults related to domestic violence have increased between 2021 and 2022. DV homicides increased 29% citywide and 225% in Brooklyn and 57% in the Bronx. Homelessness is also on the rise. There were 86,184 people in the DHS shelter system as of March 8th. And DV is a leading driver of family homelessness. 41% of families in the DHS family shelter system have experienced domestic violence. This increase demands a significant mobilization of resources. We've submitted detailed testimony into the record, and so I just want to highlight some of the most important pieces of our testimony today. We are pleased by the Adams administration's commitments to reduce domestic violence outlined in the Women Forward initiative. The administration, however, must identify new sources of funding and not simply shift around existing funding for youth violence prevention and healthy relationship education, trauma-informed accountability work with people who have caused harm, and financial empowerment advocacy for survivors and their families. We believe that DOVE funding should be increased to council districts that have been hardest hit by domestic violence without reducing the total amount of overall funding available to the council as a whole. Along with our partners, we are advocating for $6 million for NGBV's Housing Stability Support Microgrants program to help survivors of violence access safety. The human services workforce
Thank
is
you. Your
dominated
time has expired.
predominantly by women of color, and we are advocating for a 5% COLA in FY25, along with a 3% COLA in 26 and 27. And lastly, I will just add that we are urging the council to continue partnering with us to ensure that our contracts are paid on time. As you know, reimbursements for services already performed often take up to a year or more to be made. And at any given time, organizations like URI are owed millions of dollars. At any change in revenue has the potential to be catastrophic for us. And so we really appreciate your partnership and your advocacy and look forward to working with you all in the future. Thank you.
Next, we have Melanie Samuels.
Starting time.
Good afternoon, Deputy Chair Ayala. Thank you for allowing the Campaign Against Hunger to testify. My name is Raquel Grant. I'm the Chief Development Officer, and I'm testifying in Dr. Melanie Samuels' stead. The Campaign Against Hunger is a 25-year-old organization. We serve 1.4 million struggling New Yorkers every year in 145 zip codes and 14 million meals. There are 3 areas of concern for the organization. Firstly, we'd like to address food and contract reimbursement, which has been echoed by a lot of our colleagues. We're supporting 205 organizations and advocates who are working day and night to ensure families can access food. As we know, food inflation is a serious problem. We're seeing more families on the line, including migrants, and we're being asked to front out of pocket thousands of dollars to purchase food and do critical work, but have to go through the arduous contract process that can take years for reimbursement. We currently have an operational deficit, which most is tied to contract reimbursement, and we are at risk. There are also anticipated budget cuts, but no cuts on the food lines. They keep growing. So the Campaign Against Hunger join our colleagues in food to echo that funding needs to be maintained and increased for these programs. We also want to echo what Speaker Adams mentioned earlier, that agencies must prioritize backlogs so that organizations can get the funding needed to execute critical programs and services. Secondly, we want to implore DSS to assess the scale and scope of our benefits work for underrepresented families, including SNAP screening, fair fares, Medicaid child tax credit, and other services. Lastly, we're advocating for increased support for workforce development programs, which are a crucial interface to providing families with financial stability and to lift them out of poverty. We have submitted written testimony. We thank the agencies and the City Council for their continued support. Thank you.
Next, we have Natalie Pierre-Louis.
Starting time.
Good afternoon. Thank you to Chair Ayala and the members of the committee for the opportunity to testify. I am Natalie Pierre-Louis, Assistant Program Director at the Resource Center, a program of Goddard Riverside. Goddard is a settlement house working with New Yorkers from early childhood through older adulthood to strive towards a fair and just society. Our Resource Center connects people to the services they need: food stamps, legal assistance, and healthcare. We provide benefit screening, financial counseling, legal consultation, and support services. A significant portion of our funding to provide these essential services come from the NYC Benefits Program administered by the Department of Social Services. I ask that the Council please prioritize preserving the NYC Benefits Program at its current level of approximately $9 to $10 million, funding 36 providers. Since becoming an NYC benefit grantee last year, we have served a total of 472 individuals, submitted 301 applications for benefits on their behalf, managed 1,017 cases, including SNAP, rent freeze, one-shot deal, Social Security, Medicaid benefits, and the like. We advocated directly to providers and government agencies on behalf of 122 individuals to assist in moving their applications forward. I would like to share a few stories that particularly demonstrate the value of the intensive support the Resource Center can provide in partnership with DSS HRA and our technical assistance from Public Health Solutions. With the help of our PHS HRA assistants, we were able to advocate for the delivery of a new SNAP card to a homebound female adult living in East Harlem. A female Pakistani client from the Bronx who has a disabled adult son received help with a record number of 6 applications for benefits for one household. The client was recertified for reduced fare, access a ride, ACP, NYCHA Public Housing Section 8. She successfully
Thank you
applied
so
for
much. Your time has expired.
and reclaimed $760 in stolen food stamp. Finally, we assisted a single mother who had been living in a shelter for 7 years with her 7-year-old son to move into a new home at Savoy Park in Harlem. We advocated on her behalf to HRA because of this program, because of the linkage that it gives us in order for us to get the help we need. We need your help to this program fully funded and assisting New Yorkers. Thank you for your attention.
Next is Judith Sikon.
Starting time.
Hi, I'm Judy Sikon, Deputy Executive Director at New York Common Pantry.
I would like to express my gratitude to Deputy Speaker Ayala for hosting today's budget hearing, for allowing us the opportunity to present this testimony. New York Common Pantry is dedicated to addressing hunger and promoting dignity, health, and self-sufficiency for food insecure families and individuals, and we've been doing so for over 40 years. In the past year, our programs have provided almost 10.2 million meals, up from 6 million meals prior to the pandemic, and this year we are on track to serve over 11 million meals. We provided over 10 million pounds of food and assisted in accessing over $7 million in benefit dollars and served nearly 700,000 visitors. We understand how devastating food insecurity is to the mental and physical health of those experiencing it and how much it impacts the quality of life in the communities it impacts. The pandemic, inflation, and SNAP cuts have left overwhelming numbers of families struggling to make ends meet. In addition, this year's asylum seeker crisis has greatly affected us, the city, and our agency. We've seen over a 400% increase in the past year in asylum seekers who come for food and also for hygiene services, healthcare insurance, and referrals to other services. We did receive some welcome NYC funding this year, which was expended in the first few months of our fiscal year. We absolutely need this funding to be increased, and we want people to recognize that the food pantries are often unrecognized and unsung heroes of this crisis, but we continue to serve all who come to our doors. We also want to talk a little bit about the CFC funding. We are happy to see the amount up this year. We are worried about subsequent years. We also would like to encourage transparency in determining food funding allocations and to provide the information in a timely manner. We don't get our funding amounts till well into the fiscal year. We do get around July, but then we don't get the second allocation notice until December. It makes it really hard to plan and for us to
Thank you
create
so much.
sustainable
Your time has
programs.
expired.
Thank you.
And finally, for this panel, we have Rachel Bryant.
Starting time.
Thank you so much. My name is Rachel Bryant, and I'm an attorney at the Met Council, one of the largest emergency food providers in the city. And I'm here today to talk about the Community Food Connections Program. Met Council is one of America's largest Jewish charities dedicated to fighting poverty. We operate 10 departments ranging from 100% affordable housing to our award-winning family violence program to comprehensive Holocaust survivor assistance, senior programming, etc. In total, we provide a wide array of support to over 320,000 clients a year, mostly in New York City. Met Council plays a unique role in the emergency food space by offering exclusively kosher and halal emergency food, but we are committed to serving any New Yorker in need, regardless of race, ethnicity, or religion. Jewish and Muslim communities face significant barriers to food access. A recent study found that over 80% of Muslim Americans observe a halal diet and that food insufficiency within these communities was more than double the rate of all other respondents. New York is home to nearly 1/4 of all American Muslims, suggesting that Muslim New Yorkers struggle with food insufficiency at a similar and pronounced rate. While the rate of kosher observance in Jewish communities is lower, the sheer size of the Jewish population makes the kosher observant population roughly the same size as the halal observant one, and poverty rates are significant in more observant communities. During the height of the pandemic, over 20% of emergency meals, nearly 27 million meals, provided through the city's Get Food NYC program were either for kosher or halal food. Many New Yorkers are still struggling to get back on their feet post-pandemic. Studies published last week by the New York Times, the Robin Hood Foundation, and Columbia University reported that the poverty rate and life expectancies have not recovered in New York, and that 1 in 4 children in New York City now lives in poverty. We continue to serve more New Yorkers than at any point in the history of our organization, and emergency food is one of the most powerful tools we have to address these issues. Though we have immense gratitude for CFC, we must also note 2 flaws. First, though there are many kosher certified products available, CFC offers a more limited number of halal certified products. Halal certifications.
Thank you so much. Your time has expired.
Thank you. Our last panel will be Jasenia Ponce, Elise Benusa, Peggy Herrera, Jay Edidin, and Juan Diaz. Jasenia Ponce will be first.
Starting time.
Good afternoon, Committee Chair Alaya and Council members. My name is Jasenia Ponce. I am the Coordinating Attorney for Policy and Advocacy at Northern Manhattan Improvement Corporation, also known as NIMIC or NMIC. We are a multi-service agency offering legal and social services addressing housing, immigration, education, and benefits. We are one of 5 members of the Legal Services for the Working Poor Coalition that also includes Campbell Legal Services, Mobilization for Justice, Housing Conservation Coordinators, and Take Root Justice. We have many points written in our testimony, but I will summarize here 2 key points that reflect the importance of funding legal services for the working poor, also known as LSWP. One is the wide range of services we are able to provide due to the flexibility in funding. As my colleagues in this room and many know that not one client walks through our doors with a single issue. We are able to provide wraparound services with LSWP that include immigration, benefits, and other areas of civil practice. Second, LSWP funding opens doors for services that the working poor may not otherwise be eligible for. As you know, working people with earned income do not qualify for many low-income services, but nonetheless are one paycheck away from becoming homeless. LSWP allows us to offer assistance to keep working poor communities stable. For these reasons and the reasons listed in our testimony, it is crucial that the council not only continue support for this flexible funding stream, but we ask respectfully that the council increase funding to $600,000 for each coalition member so that legal service organizations are able to meet the needs of their clients by providing a diverse array of civil legal services for working poor New Yorkers. Thank you.
Next, we have Elise Benusa.
Starting time.
Good afternoon. My name is Elise Benusa, and I'm the Government Relations Manager at Planned Parenthood of Greater New York. I would like to thank Chair Ayala and all the committee members for the opportunity to discuss Planned Parenthood of Greater New York's programs, services, and funding requests. For over 100 years, PBGNY has been a trusted provider of sexual and reproductive health care and education programs for communities throughout New York City. In 2023, our New York City health centers conducted almost 70,000 patient visits, providing care to all those in need, regardless of immigration status, identity, or ability to pay for services. This is why today we respectfully request support from the Speaker's Initiative for our Youth Health Promoters Program and Youth Serving Programs. The YHPs are highly trained peer educators who engage other young people and conduct interactive workshops to educate youth about their rights and access to care. The YHP program is unique in that it taps into credible peer youth messaging to advance sexual and reproductive health outcomes for young people throughout New York City. In 2023, the Youth Health Promoters reached over 1,000 youth at schools and in the community. Funding from the City Council will allow the YHPs to expand their peer engagement work to ensure more young people have access to the care they need. With the ever-changing national landscape and continued attempts to restrict access to care, New York is seen as a haven for critical healthcare services. We ask the Council to continue to fund PBGNY through the Reproductive and Sexual and Health Initiative to allow us to continue to provide sexual and reproductive healthcare services and educational programs throughout New York City. PBGNY provides a full range of sexual and reproductive healthcare services that includes gynecological care, STI testing and treatment and testing, contraceptive care, cancer screenings, and LGBTQ+ healthcare at all 5 of our health centers in New York City. Another program that allows us to continue serving vulnerable New Yorkers, including our immigrant populations, is Project Street Beat. We ask for continued funding support from the Ending the Epidemic Speakers and the HIV/AIDS Faith-Based Initiative to support Project Street Beat. Project Street Beat provides targeted outreach and services to communities.
Thank you so much. Your time has expired.
Just one more sentence. Through our mobile health centers and our PSB offices in the Bronx and Brooklyn, PBGNY continues to be committed to ensuring that all New Yorkers, no matter their background, get the care they need. Thank you so much.
Next is Peggy Herrera.
Starting time.
Hi, good afternoon. Do you hear me? Can you hear me?
We can.
Okay. Good afternoon, Deputy Speaker Ayala and committee members. My name is Peggy Herrera. I am a leader and a member with Freedom Agenda and the Campaign to Close Rikers. I am also a mother who tragically lost my son to gun violence. As a mother, as a youth counselor, and as a New Yorker, I know that our communities are struggling. People are in survival mode, and yet Mayor Adams still seems committed to the same failed approach of throwing us crumbs for everything that's important or cutting the things that will truly benefit our communities. Our mayor and the governor, along with her, talk about safety, but they don't seem to get that it's an investment in our communities and mental health that will bring crime down, not more policing and incarceration. The Department of Social Services is responsible for delivering the kinds of support that our communities desperately need. They need to be able to do their job, to get people their food stamps, to issue housing vouchers, to run job training programs, to connect people with supportive housing, and so much more. So, why is DSS facing funding cuts, but not the Department of Correction? Why is the mayor cutting their staff, but not DOC's headcount? We know what the impact will be. People who are already struggling will be waiting longer and longer for the help they need. The stress of poverty will impact their mental health. While they wait for follow up from the agency that is supposed to help them, they'll probably come into contact with the only agency that seems to have enough resources to be everywhere all the time, the NYPD. After the NYPD targets them, they get funneled to the Department of Correction to be abused on Rikers, the most expensive jail system in the country. It makes no sense morally or financially. I know that the safest communities are the ones with the most resources. And I think that the city council knows that too. That's why the council voted to close Rikers and has stayed committed to that goal. To make that goal a reality, we need a budget that moves us toward more
Thank you
care
so
and
much.
less
Your time
incarceration.
has expired.
Thank you.
Jay Adidian.
Starting time.
Thank you, Deputy Speaker Ayala, members of the General Welfare Committee, both for the opportunity to testify today and for your fierce ongoing advocacy on behalf of the most vulnerable New Yorkers. My name is Jay Editon. I'm the Director of Advocacy at the Women's Community Justice Association. As of last week, at least 1 in 5 of the women and gender-expansive people currently incarcerated at the Rose M. Singer Center on Rikers Island is unhoused. 1 in 5. And the charges that that population faces are overwhelmingly for nonviolent survival crimes, crimes they would not have needed to even consider if they had access to resources to which every New Yorker, every human being, has a fundamental right. 80%, that's 4 of every 5 of the people at RMSC, have some sort of mental health concern. Nearly that many are primary caregivers. Many of them have struggled to access adequate care in the community and would have been far better served by community-based alternatives to detention and incarceration than by their current situation. Mayor Adams discusses mass incarceration as if it were an inevitability, a matter of simple math beyond his control, and then in the same breath makes catastrophic cuts to community services and to alternatives to incarceration and detention. As some of you already know, the Adams administration's plan for the upcoming Queensboro jail more than tripled the agreed upon number of beds for women and gender-expansive people, from 126 to 450. This is happening at a time when mass incarceration of women is rising at an alarming rate, disproportionate to either the incarceration of men or, and this is the part that should make all of us especially angry, rate of criminal offense. I call on this committee to continue to resist that fear-mongering, to look at the actual crime statistics and the price, human and financial, of the city's embrace of mass incarceration, the destruction of lives and families, the waste of taxpayer dollars, and for what? A bloated, inhumane, and ultimately ineffective system. Look at the Women's Community Justice Association and Lippman Conditions Path to 100 report, which offered simple, direct, and effective interventions to lower the population of women and gender-expansive people caged by the city. Look at the data on reoffense and how it differs between incarceration and ATIs. Mayor Adams,
Thank you so much. Your time has expired.
I call on the committee to prioritize community resources and alternatives to incarceration and to resist the sprawl of borough jails.
Thank you. Before I call the last virtual witness, if there's anyone on Zoom that has not had the chance to testify and has not been called, can you please use the raise hand function? I don't see anyone, so I'll call our last virtual witness, who will be Juan Diaz.
Starting time.
Thank you. My name is Juan Diaz. Thank you, Chair Ayala, and all members of the Committee on General Welfare for holding today's hearing. My name is Juan Diaz, and I'm a policy associate at Citizens Community for Children, a multi-issue children's advocacy organization. CCC is a co-convener of the Family Homeless Coalition. Today, I will focus mainly on our recommendations to combat family homelessness, but our written testimony will contain additional recommendations related to child welfare, youth justice, and food insecurity. New Yorkers are experiencing serious delays in essential housing and public benefit service applications, as well as severe vacancy rates at social services organizations and delays in payments to community-based organizations that provide essential services to vulnerable New Yorkers. We urge the city to invest in programs and strategies that will prevent family homelessness. We therefore urge you to take the following steps. Implement the city FEB's expansion, which will significantly expedite the housing support for families in the community and in shelters. Improve public benefit access and retention by removing red tape, and implement the technology solutions to ensure that housing subsidies, payments and renewals, and public benefits are secure. Prioritize access to home-based services by providing funding to support community-based organizations who administer homeless prevention programs to keep up with the ever-increasing demand of services. Resolve contracting issues and payment delays to community-based organizations providers that impede workforce and service stability. Baseline funding for community-based community coordinators to help children to get to school every day and to access much-needed educational support. We urge the city administration to implement meaningful COLA for homeless services staff. And finally, we urge the city administration to invest in streamlining the approval process of vacant affordable housing units by reducing repetitive paperwork and hiring the necessary staff. Thank you for the opportunity to testify.
Thank you. And we have finally Janine Costley.
Starting time.
Thank you. Good morning, Chair Ayala and members of the Committee on General Welfare. Thank you for this opportunity to testify today. My name is Dr. Janine Costley. I'm the Senior Vice President of Transitional Services at the Institute for Community Living, ICL. We are one of the city's largest providers of housing and behavioral health services for children, adults, and families. We serve over 13,000 people annually in our 140 programs across 5 boroughs, including clinics, shelters, residences, and community-based programs. I'm here to talk about the city's concurrent mental health crisis and homeless crisis and what must be done for nonprofits like ours to survive, to help people who we support. Nonprofits face significant challenges in retaining quality staff. We can't begin to address the mental health and homeless crisis without substantial investment in our woefully underpaid workforce. ICL faces exceptionally high turnover rates and vacancy rates, with turnover rates of 32% across our programs and a massive 70% in our shelters that we operate. We need more funding to achieve pay parity with state-funded programs that jeopardize our city-funded workforce by offering more generous compensation. There must be a cost of living adjustment so our workers' compensation can keep up with inflation and so they're fairly compensated for our challenging work. Now is the time for meaningful transformation of our shelter system. We thank the City Council for your leadership and advocacy in preserving the right to shelter law, but that's not enough. Shelters are often too large and under-resourced and located in buildings with bad layouts and other unfavorable conditions. There have been no increases or adjustments to the funding to reflect the growing food costs, the insurance costs, or operational expenses. This threatens the viability of nonprofit organizations like ours. The city's delays in payments are also
Thank you so much. Your time has expired.
We must regularly borrow money to provide our contracted services. The bottom line is that we need a broader investment in funding for our shelter services and the workforce that ensures our operations. And thank you so much for this time.
Thank you so much for your testimony and for the great work of ICL. We really appreciate everything you do. And with that, after a long day, this hearing is adjourned. Thank you all.